Talking About Horses, bringing you closer to some of the best horsemen in the world for tips, insights, and stories. Listen at home, at work, in the car, or in the saddle. This is Talking About Horses. Here's your host, Patrick King.
Hey there, gang. Patrick King here, and I want to thank you for tuning in for episode number 32 of Talking About Horses. Today, I'm pleased to be joined by Dr. Joyce Harman. Dr. Harman finds the best approach for the horse is a team approach involving veterinarians, therapists, farriers, dentists, riding instructors, and saddle experts. She became the first veterinarian to acquire a computerized saddle fitting device. She's written the book on saddle fitting, very literally, with 2 volumes, the Horse's Pain-Free Back and Saddle Fit book for Western and for English horses. She also has a booklet to help introduce people to homeopathy for horses, the first aid guide to homeopathy for horses. Her goal is to educate people, her goal is to help educate the equine industry about natural, holistic, and integrative medicine. Dr. Harman, thank you so much for joining us here on Talking About Horses.
Thank you for having me. I look forward to sharing some information and seeing what people are interested in. I've been doing this since around 1991, which makes me one of the old guard. And I just saw that conventional medicine left me with a lot of questions. And I'd been exposed to acupuncture when I was in vet school and had the opportunity to study it, and once I was exposed to what it could do, I just knew in my heart that this was my life path, and I felt like I could make a difference to the horses. And that's how I feel still, however many, 25, 28, many years later, is that this, I have a big toolbox of lots of different things. And for many of our chronic diseases and many of our issues that we struggle with from a conventional perspective, I have lots of tools for that sort of thing. And that's what makes it fun and interesting, and at the same time challenging, because we always want the magic bullet. And truthfully, I want the magic bullet too, but yes, I don't have it. There isn't one out there. So the beauty and the curse of integrative medicine and holistic medicine is that every animal is an individual. But the beautiful part of that is that you all know your horses are individuals and that they react differently than your friend's horse might. And so holistic medicine and integrative medicine take all that into consideration. So it makes my day job fun and interesting and challenging, and it allows me to help a lot of horses from a different perspective.
Certainly. So for folks listening, can we kind of throw out a couple definitions? Can you explain to me what you mean? So we're talking about conventional medicine, holistic medicine, and then integrative medicine. What does all that mean?
Okay, that's a really good place to start because it gets confusing. So if we look at the term holistic medicine, that is really an umbrella for many things. So under the umbrella of holistic medicine is acupuncture, chiropractic, osteopathy, massage therapy, physical therapy, which physical therapy really should be considered conventional, but it's still considered alternative in the horse world. And then we have things like homeopathy, which is a science unto itself, and a method of treatment with its own types of medicines, and we can talk about those later if people are interested. And we have herbal medicine, and then sort of under the herbal medicine umbrella, which is still under this holistic umbrella, the herbal medicine, we can have Western herbal medicine, originating here in the States. We can have European herbal medicine. We can have Chinese herbal medicine. We can have Ayurvedic or Indian, and we can have American Indian. There's many, many different cultures had and used herbs. Australia, New Zealand, you name it. Everybody, that was all they had thousands and thousands of years ago. So all of those aspects of alternative medicine or holistic medicine fall under that umbrella.
Gotcha.
And there are other things. There's energy work. There's a lot of machines that produce red light or produce electrical stimulations, all kinds of things like that. That all fall under this holistic or alternative medicine. And the real idea behind holistic medicine is that you're looking at the animal as a whole, which is where the holistic fits in. So if your horse has a cough, the holistic practitioner is also interested in any skin disease, any hoof problems, any behavior issues, and is likely to prescribe something based on everything about that horse. Conventional medicine is what we're accustomed to with our antibiotics, our steroids, but also things like x-rays and ultrasounds are all considered conventional, and surgery, medicine, those are all fall under our conventional therapies. And we actually have a little sort of in-between therapy with things like PRP, platelet-rich plasma injections for injured tendons, which are a little bit out of the mainstream, but actually in the horse world are considered now part of conventional medicine. And yet they're really working with the body to heal the problem, which makes them a little bit of a bridge to holistic medicine.
Okay.
So then integrative medicine is looking at everything and doing the best that is needed at that time. So if your horse has a serious colic, the very best place for you to be is on the surgery table with conventional medicine. And yes, you can use some alternatives to help heal the issue afterwards, but surgery is what you need. The same thing with a fracture with an acutely bowed tendon. You might want some of the PRP. There's many, many places where conventional medicine is the first place that you want to go. A lot of your chronic problems, all we really have in conventional medicine is painkillers, anti-inflammatories, and maybe some steroids. And we can do our best by using our alternatives, and those often are your best first line. But then we want to know, what's really inside that foot. So we go back to our conventional medicine and have an x-ray or an ultrasound or an MRI or something fancy like that. So integrative really is the best place to be, and taking into consideration everything that you need.
Okay. So it's the best of both worlds, or all worlds.
It's incorporating everything at our disposal, and then trying to pick what would be the most appropriate in the situation.
Gotcha.
So the colic surgery is most appropriate for the twisted gut, but for the arthritis, the alternative medicines, the herbal therapies, the acupuncture are really the best choice.
Okay. Over the painkillers or the steroids that are just going to blanket over the problem, right?
What happens there a lot of times with our chronic problems is that the medicines can be effective at masking the pain, but the actual disease process does continue on. So you start out with a half a tab of bute, or a Previcox, or a half of a Previcox, or something like that. And next year it's a whole tab of bute, and the year after it's a couple of tabs of bute, or it's more Previcox. And that's because the disease is continuing to progress, and all you're doing is really masking the symptom. When we come in with our alternative medicine to something like an arthritic horse, we actually can enhance things like the joint fluid. And many of our joint supplements are actually very mainstream now and are prescribed by people who are otherwise totally conventional, in quotes, veterinarians, because they see that those joint supplements are actually making a difference to the quality of the synovial fluid and to the joints themselves. And so you keep a horse going for a much longer period of time. And yes, maybe you need a joint injection, or maybe you need some bute or banamine when they're 25, or some Prevocox or something, but you might get an extra 10 years of a very sound, comfortable horse by using the nutritional supplements, or
Gotcha.
acupuncture, or something else that is actually slowing down the disease process, or even in some cases reversing it.
Okay. Okay. So if we were thinking about that arthritic horse, we would say the conventional approach then would be something like the bute or the Prevocox.
Yeah, the bute or the Prevocox as far as an oral supplement for a generalized or a painful area.
Okay.
And then we also have our joint injections, which can be very beneficial, but they are putting in usually something like a hyaluronic acid type of product, and usually a steroid at the same time into a specific joint. And even in this integrative world, you can be doing acupuncture on a horse and doing some chiropractic and some joint supplements, but you actually find that hock really is a problem, and it will benefit from a specific injection into that joint, and then the whole rest of the body stays healthier.
Gotcha. Okay. So potentially the supplements or the acupuncture just aren't enough to really make a dramatic difference in that case?
In a particular case, let's say a particular joint where there has either been an injury or there is a lot of degenerative bone disease before you start the treatment, we can't take a bone and reverse all the degeneration with any medicine, alternative or conventional.
Sure.
But we can enhance the health of that joint, knowing that it is compromised by our acupuncture, and we can relieve a lot of the pain. But if we have a joint or several joints that are compromised, and that cartilage has begun to degenerate, and there is bony growth, bone changes that you can see on the x-ray, those sorts of things we can't reverse with our acupuncture or our joint supplements, and that's where we may have to treat the joint itself at the same time that we're working on the rest of the horse, so that all the compensation areas don't begin to degenerate.
Gotcha. Yeah, that makes perfect sense, because the horse is certainly going to be compensating the movement patterns and the balance and all of those things. Yeah.
Yes, and that's one of the reasons why a lot of times you give just, say, the Prevocox, and yeah, the horse is better, that joint isn't really bothering him, but you have 2 or 3 other places that are under stress because the movement has changed. And as anybody knows that's had a sprained ankle or something like that, the movement through your whole body changes while that ankle is painful. And in many cases, even when the ankle has healed, the ankle joint itself may not be totally normal, and your body movement has actually changed as well. So you go in and do the acupuncture, the chiropractic, mobilization, stretching, massage, whatever, And the whole rest of that body now is in good shape, and it's not going to put as much stress on that joint that's bad.
Gotcha.
And it's definitely not going to put as much stress on the front leg that's sort of opposite that bad hock.
Okay, right. Well, that makes me think in the past I've broken both of my legs, thankfully not at the same time, but thinking about, the compensatory patterns that I developed in that, on the first break, I was wearing this gargantuan walking boot. It kind of looked like I had elephantitis. So I weebled and wobbled around, so I found myself, even up to a few years later, until I really realized what was going on, I found myself wearing my shoes on the opposite foot at a completely different angle, because of that compensation of my movement patterns. And then the second time I had to have, a couple surgeries on my ankle, and I found myself with shoulder issues because of crutches and because of, again, different movement patterns. So what we're saying then is the holistic approach, or the integrative approach, maybe is about resetting the whole body.
Exactly.
Gotcha.
And what you described is exactly what happened.
Okay.
And horses are so athletic that very often they are already compensating before you even notice that they are painful.
Okay.
And it often happens, certainly after a crash and burn or broken leg or something like that, you get to see exactly what happens to the body in all of its compensation. When you have something like, say, some hock arthritis, which is so common, very often that is very slow to gradually get worse. And the horse is going fine, competing fine, doing things fine. And then you notice that maybe the turns aren't quite so clean. And maybe the lead changes aren't quite so clean. Maybe they're not quite as sharp coming out of the start box. And you just sort of, you're not quite sure that there's a problem because they're not limping yet. But those small and subtle behavior changes are already starting all the compensations throughout the rest of the body. And by the time you actually have that hock and that lame leg, and you call the vet out and you do a hock flexion test, and you go, yeah, this hock is really sore, that horse has already compromised the shoulder, maybe the base of the neck, maybe the lumbar area in the back. All of those areas are already under stress. And so if you come along and you inject the hock will then no longer be painful, and the horse will definitely improve. But the comment most of the time when you inject the hock and work on the rest of the body is they've got their old horse completely back.
Okay.
Because everything else is also loose and ready to go and totally functional.
Gotcha. So you're removing the progressive habits that have come up along the way.
Right.
Okay.
And in many cases, we have something like hock pain, and this is a really good one to pick on. And that will actually originate with back pain. And so if you correct the saddle fit and do some acupuncture or some chiropractic on the back, many times the hocks actually get better because the hock was not the original problem. The back was the original problem, and the horse started to move improperly, just like you were doing on your crutches, only in a much more subtle way. The horse starts to compensate, not quite round his back over the fences, not quite bend around that barrel, not quite do everything the way it did before. And as soon as you stiffen the back, then the hocks and the ankles and the knees have to take up the slack. So a great exercise and everybody can do this while they're standing there listening or sitting there listening, is to stand up and make your back really hollow and stiff, and then try to pick up one of your hind legs and see how far it goes. Then you'll find that it doesn't really go very far. Mm-hmm. Now round your back and then pick up your hind leg, and you'll see that you can begin to stretch that leg almost to your chin if you're super flexible, but you can stretch it twice as far as if your back is stiff. That's exactly the same thing that happens when the horse's back is stiff.
Okay, so then it's the articulation of the, in that case, I'm picturing trying to do that, although it would probably be interesting. I'm on camera here. Everybody would love to see me probably playing with that idea. But I'm picturing then the lumbar spine and the pelvis, when you're holding your back stiff, they're not going to articulate properly.
Yes, exactly.
And so that's what's limiting the hind leg. So then when we're talking about back pain in the horse, we're talking about then his barrel can't shift properly to move with the hind legs. So now the hind leg is impeded in its stride. Is that right?
Yes, absolutely.
Okay. Makes perfect sense to me. That's
and
really
then you want to move the rib cage. You can't move the rib cage.
Yeah.
The back is stiff. And then, because remember the old song, the head bone's connected to the neck bone's connected to the tailbone.
Right.
Everything's connected. So then you start to see that maybe they aren't turning so well with their neck, because the neck is now the compensation or the balancing point for that pelvis that can't move properly.
Gotcha.
And so we see so many different signs and symptoms, and really what people will call resistances in the horse. And most of the time, it's not a resistance. Yes, there are horses that hate dressage, or there are horses that hate to jump, or they, hate cows, or whatever. But for the most part, that's not true, and they certainly don't sit in their stall at night and go, I am not bending right. No matter how hard my rider makes me bend, I'm not going to bend to the right. I'll bend to the left all day, but I'm not going to bend to the right. Horses don't do that. If they can't bend to the right, there's a reason. It may be coming from their teeth. This is the whole holistic thing. So you have a horse that doesn't bend to the right. So you start at the mouth. Okay, maybe their teeth are bad. Maybe they have a stiff neck from having pulled back on a halter when they were 2 years old. Maybe they have a saddle that is pushing into that right shoulder. Maybe they have their right front foot as more of a club foot. Maybe they have the left side of their rib cage, because remember, to bend right, the left side of the rib cage has to go out to the left.
Right. It's expansion and contraction. One side gets smaller, the other side gets longer. Yeah.
So maybe the left side of the rib cage can't bend out, or maybe the right side of the rib cage can't compress. Maybe the lumbar spine is stiff, and the pelvis can't actually come under to make that right bend. Maybe that right hock hurts when they land on it. Maybe the left hind, either the hock or the hip or the gluteal muscle, is too sore to push off going to the right. Maybe there's foot pain in that right front foot, and as soon as they load it, it's more uncomfortable. Each one of those scenarios, plus many more, could be a reason for a horse not turning right. Not because they don't want to.
So oftentimes the resistance is not from a lack of desire, but from a lack of, at least in the horse's, somewhere in the horse's body, it's from a lack of a comfortable ability at the very least.
And there certainly are times, because we haven't thrown the rider into this equation.
I was going to go there next. Yeah, right.
So we have the saddle, which could be crooked or
Mm-hmm.
interfering.
Mm-hmm.
The saddle is a communication device from the rider,
Mm-hmm.
and the rider is dynamic in this whole process. So let's say the rider's right side is very stiff. So the horse may just be mirroring the rider and unable to bend because there's no give or no correct signal.
Mm-hmm.
And then we also have to put into the equation that you might be teaching the horse something new, and maybe he doesn't understand it yet. So
Right.
there is that piece of education that
Right.
can
Right.
fall into it as well. But I would say 95% of the time, we're going to be looking at a physical reason why they can't do the thing you're asking them to do.
Mm-hmm.
Maybe 90%, because we do ask horses to do things that we don't always explain clearly.
Yes. Right. Right.
And sometimes we don't explain it in the horse's language. You know, if a horse is trained by one rider to canter with putting the opposite leg behind the girth, that's that horse's language. That's like speaking English. You put another rider on who wants to canter on that same lead but uses the opposite leg to ask.
Yes.
You have just spoken in German
Right.
to that horse. And so the horse is like, but I have no clue what you just said.
Mm-hmm.
And that, so they are confused. And so they might not be able to turn or take that lead because they just don't understand the language.
Right.
So once they've learned your language, then they should be able to respond unless their body does not let them
Mm-hmm.
respond.
And potentially through the misunderstanding, we're also going to run into compensatory movement patterns, right? And
absolutely.
bracing and
Mm-hmm.
all of those other things. And now the rider's not getting what they want, so they're pulling back on the reins, and they're going through all these other things that have an effect the rest of the way through the body.
Yes. And we have saddles that may fit the horse perfectly but don't fit the rider. So the rider becomes a saddle fitting problem.
Yes.
And it's not through any fault of their own. It's because the saddle's not correctly balanced for them or the sport they're trying to do.
Right.
There's so many things that go into it, and there's a whole bunch of riders that need to go see an acupuncturist and a chiropractor as well, just to get there or learn stretches or do yoga
Mm-hmm.
or do something to balance ourselves, because the horses will mirror us.
Right, absolutely. I had a mare years ago that was the first one to tell me when I needed to go to the chiropractor. Because if I had a back issue or a hip issue, and it was for me, it was consistently an issue to the left, she would go down the trail or around the arena and haunches in. And luckily I was close enough to the chiropractor, I would just call him and visit and come back and finish the ride, and she'd be right as rain.
Yes.
Yeah.
Perfect example.
Yeah. So often we find it hard to hear our horses, to listen to our horses. And that's the biggest piece of it. I see it all the time in clinics. I'm sure you see it oftentimes, all the time, daily probably also, with your practice. How can we develop better listening skills? Because doesn't it come down to that, really?
Mm-hmm. It really does. And the idea behind listening to the horse is asking the question, when the horse presents you with what you in your brain say, well, he's resisting me, he doesn't want to do this. When your brain goes to that space of this horse is not cooperating with me, instead of putting it into those words, if you reverse those words and you say, why is this horse not cooperating with me?
Mm-hmm.
And then go a little farther and say, okay, what could I do to find out why this horse is not cooperating? Then you start to look, and you literally can start at the mouth with the bit and the comfort of the tongue.
Yes.
With the teeth needing to be done. And the very hard thing with teeth is that as the horse owner, you can't see them. And when you stick your fingers in, it's really easy to get bitten.
Right. You've got 10 chances to mess that up.
Yeah, I mean, at least with the feet, you can learn about feet and you can see it. With
Right.
the teeth, it's really, really hard. So there are a lot of horses with bad teeth, and there are a lot of horses with bad teeth who have had their teeth floated by somebody, whether it's a veterinarian or whether it's a horse dentist, or whether it's the local farrier who just happens to have some floats. And so I see many horses who have very bad teeth, and there can be even in some pretty posh places. And so you got to start right there at the nose, and then you even look at the bridle. Look at the comfort of the bridle across the brow band area, across the ears. Anything that's pinching or constricting in that area. You get these quarter horses that have a small head, but they have a super wide forehead. So they take sort of a cob-sized bridle, and they take a warm blood brow band.
Right, yes.
That's a much bigger issue than people think about. Then you can go down and say, get a carrot and do some carrot stretches and see if that horse's neck bends the same way in both directions. Take the carrot, stretch it around to the shoulder, then take the carrot and stretch it around to the hips. And a normal horse should take his head and turn it straight around to the shoulder and then stretch it back to the hips. A lot of horses can't turn, for one thing. They can't even touch their shoulder. Or they can go part way in one direction and all the way another direction. Or they're very good at cheating, and they'll take their head and rotate it down and snake it around and eventually get to the carrot. But they can't turn their head just straight around to their shoulder.
Gotcha. So that would be more base of the neck and occipital pole in that moment, right? Where they're just rotating the head then through C1,
if you're
C2.
Rotate the head, you're looking at the upper part of the neck.
Okay.
The occiput, where the head connects to the neck, and then even the second cervical vertebrae. When you get down into the horses have 7 cervical vertebrae. When you get down into the middle of the neck, it's usually they can't turn their head all that far, and they definitely can't touch their shoulder.
Okay.
And if they can't reach all the way back to their pelvis, or what people tend to think of as the hip, they can't reach all the way back there, then it could be anywhere in the neck, but a lot of times the base of the neck is also involved.
Gotcha. Okay.
And if you watch a horse doing that, most of the time they actually have to stretch the rib cage on the opposite side to get all the way back to their hip. So you could have some restrictions in the spine itself or in the rib cage. Gotcha.
And picturing in my mind's eye that happening, oftentimes the outside foreleg takes a step forward as well.
Yep.
In that. So you're also potentially in a neck bending challenge. You're also looking potentially at a scapular issue or a shoulder issue.
Yeah, absolutely.
Okay.
Because they don't have that freedom to slide that shoulder.
Yeah, okay.
And so as you're doing these sort of body checks, then you're saying, okay, so what moved here? The horse, if it was perfectly normal, would just turn his head around and touch the shoulder. But now we've got this leg involved, and we've got him shifting position, and he's really trying to not stand still. And occasionally they have learned that they can cheat, so you put them against the wall. But many times you can put them against the wall so that they can't move away from you, and you find out that they can only move a third of the way around.
Gotcha. So having that borderline there really starts to show you the limitation.
Yes.
Gotcha.
Yeah. So then you come down to the back area, and you can do a lift with a belly lift.
Okay.
And that can give you a tremendous amount of information. So you're reaching underneath the horse, kind of in the girth area, tickling around where the girth would go, and gradually putting pressure on it. But you have to be careful, because there are a lot of horses that are very painful, and you go to lift their back up, and they will kick or bite.
Mm-hmm.
So you don't just walk up to a horse and stick your hand underneath its belly and ask it to lift its back. It's a good way to lose your kneecap.
Sure.
But that will tell you that if they can't stand still and lift their back up comfortably, how are they going to lift their back up comfortably when you're on their back?
Right, yeah.
So that tells you, usually if they're ready to kick and bite at you when you try to lift their back, you need a chiropractor, a massage therapist, stretching, osteopathy, something like that, to get those joints moving again, because those are really painful situations for horses. And most of our riding, we are asking the horse to come up in its back, through its withers, and then up through the pole. And I would say half the horses I look at for the first time cannot lift their back easily.
Wow,
and there are days I think it's 75% of the horses that I see.
So when we say we want the horse to lift the back and lift up through the base of the neck and eventually lift up through the pole, that's also assuming that we're riding properly and focusing on the proper biomechanics of the horse.
Well, yes, that's very true as well. and really actually understanding what that lift and that that movement is and what it's supposed to be and what it's supposed to feel like. And because a lot of horses can't do it, we actually, many of us have never had that opportunity to really feel it.
Right. It's really hard to take into account the anatomical characteristics, the biomechanical truths, when we may have never been exposed to them. Right.
So there's a great book by a veterinarian chiropractor named Renee Tucker called "Where Does My Horse Hurt?"
Okay.
And that's a good. It takes you down sort of in lots of pictures through what I'm talking about here, in just examining each part of the horse's body to say, does something hurt? And showing you all the ranges of motion that a horse's body can go through, and how to check it without doing any harm as well.
Yeah, because that's something we need to really keep in mind too, is that, we could go out and play with our horses and pull a shoulder and stretch here and push there. But if we don't know what normal is supposed to feel like, then we don't know what abnormal is supposed to feel like. So potentially we could cause damage, right? By doing something that maybe we shouldn't have.
Yes, and the rule of thumb, and if you follow this rule, you can poke and prod at your horse pretty safely.
Okay.
And stretch them. And the rule is that you never force any movement. So if you pick up, let's say you're going to pick up a hind leg and you want to stretch it out behind the horse. A lot of horses have very tight hips, very tight psoas muscles, and the muscles for the psoas, it sort of bends the hip forward. It's why your farrier can't stand up straight, because he has tight psoas.
Yes, right.
And those are actually really important muscles for people, for riding.
Yes, certainly.
You need to have those loose. But on horses, those are very often tight. So if you pick up that hind leg and the horse does not give it to you to stretch it behind, you don't pull. You hold the leg, maybe shake it a little bit gently, and you wait for him to release. So if I tell probably most of this audience bend down, touch your toes, don't bend your knees, and don't warm up. What are you going to tell me? It's going to be a little ugly.
Right.
There's probably some young people out there who can do that in their sleep, but the rest of us, we need that warm-up time.
Yes, right.
So if you just think about that concept, if I then tell you, okay, my goal is I want you to touch your toes, and you can take all day to do it. Stretch slowly down and get as far down as you can get. You can do that because as you stretch slowly, those muscle fibers, the tendons, the ligaments, the scar tissue from the last time you fell off the horse, all of that has time to release. So you pick up that hind leg on the horse and they pull it up tightly underneath them. You just sit there and wait.
Yes.
And you'll find within 30 seconds, a minute, occasionally as long as 2 minutes, that you'll end up having that leg stretched 6 inches to a foot behind the horse. And if you do that on a regular basis, then you'll pick that leg up and stretch it out, and the horse will be able to stretch it out easily. And that means that those tissues are now relaxed, and you're going to have better performance and a healthier joint because everything is moving smoothly.
Right. The waiting part, I think, is the hardest part for folks. 30 or 60 seconds. I mean, come on, Joyce. We've got a lesson to get to. We've got to. I got things to do. I'm meeting my friend for lunch, and so my horse just needs to get with the program here. But so we also, though, this is something I see often in my clinics as well. We also run into the psychological tension that has been accompanied with the joint tension and things like that. So even when the horse is theoretically better in the body, they'll still have that tension through the mind that's going to cause that joint tension.
Yes, and you will certainly have the muscle memory, you have the learned behaviors. One thing, though, I find fascinating is that when you truly remove the pain, horses let go of that body position 10 times faster than people.
Ah, okay.
And so this is where a lot of times we come in and maybe you do a chiropractic adjustment, but haven't really taken the extra time to address those muscles and stretch them out. So that muscle is still tight. The joint might actually be moving better, but there's still some discomfort because you've got muscles, ligaments, joint capsules, and things that are still tight. And this is where that sort of holistic looking at it comes into play. Okay. If I take a bunch of horse bones and put them in a pile on the ground, I have a pile of horse bones. If I put cow muscles on it, it's going to look like a cow because the bones don't really care.
Yeah, right. They go where they're told. Sure.
So we have a horse with a really upside down cow-looking neck. It's all soft tissue. It's all tension that is holding those bones in that place.
Yeah.
If we come along and do a 5-minute chiropractic adjustment and loosen up the neck and loosen up the back and leave, and have no follow-up of stretching, of releasing the muscle tension, then you still have all the behaviors associated with it because you haven't actually completely addressed the problem. Gotcha. You have addressed a piece of it.
Yes. So then those muscles are going to basically pull the bones, right, that we're presumably fixing with the chiropractic work. The muscles are just going to pull them right back to where they were originally.
Right.
Gotcha.
Which is a lot of times why even with human chiropractors, you'll see, you go to a sort of traditional human chiropractor and they come in, they give you a quick adjustment and they say, see you on Thursday. This is Monday. And then Thursday you go in, they say, see you Monday. And so you see them like 2 or 3 times a week. Well, what they're doing is loosening up the joints and just hoping that the muscles follow. It's a lot more effective, and some of the chiropractors do this and actually do some muscle work, whether it's having you see a massage therapist before you get adjusted, whether it's lying on a little vibration table to kind of loosen you up. But there are many chiropractors, human chiropractors, who have added some of that muscle and tissue work to their practice.
Yes.
And a lot of the veterinary chiropractors have, and some of them haven't. But if you, as the horse owner, go and do your stretches, you can enhance that chiropractic work and the acupuncture work. Because a lot of times, if you just do acupuncture, you haven't actually addressed those structural tensions that are in the spine.
Okay.
And you'll have the same sort of thing. You keep coming back and doing the acupuncture, but you haven't really gotten that neck loose. So do your homework, do your stretches, and you'll find that it really is all about soft tissue. And when you come to something that you just can't loosen up, that's when you need the professional, either the acupuncturist or the chiropractor, or a professional massage therapist, or some kind of, there's many different kinds of body work out there. And you want somebody who's good and experienced and who's not brutal.
Yeah.
Because when you get body work done that's done with a lot of force, you're actually creating micro tears in the joints instead of loosening them up. And over time, initially the horse might be looser, but over time you actually will see joint damage from people who use really brutal techniques, crack the whole body or pick the horse up and slam it against the wall, or there's a lot of really rough things done out there. Horses are easier to adjust than people are sometimes. They're just big, and you have to use gentle techniques, but or spend a little time releasing the muscles, and they do great. They really respond well.
Sure. Well, I know even in clinics that I teach, we'll work with in-hand work, and we'll find as the horses release through the top line and relax through the muscles. I joke all the time, oh, that's a $20 copay, because we'll daily hear, the audibles that come with, joints returning to normal mobility. Yeah.
Yep, because it's soft tissue.
Right.
And there's so much that you can do through your riding, through your stretching, through your just thinking about, on a cold day, put a hot towel on their back if they're a bit tight. You're going to go home and take a hot bath. So give them, you don't want to necessarily wash them down with hot water when it's 20 degrees outside, but you can take a moist towel that you've moistened in hot water and put it over their back and relax it.
Gotcha. Yep.
So yeah, you can do it through training, you can do it through stretching, you can do it through releasing tension.
Yeah. And that tension causes dis-ease that would then often be the cause of the disease. Yeah. As far as the compensatory challenges and the arthritis that comes associated with that, and all of those things.
Yeah, absolutely.
Interesting. So then your advice would be focusing on the stretching first?
Yes.
Okay.
And what you do is you start to stretch your horse regularly, and believe me, do I stretch my horse out every time before I ride? No, because I have that same schedule. But I do try, when I'm riding regularly, to at least one day a week make sure I do a really good stretch. And, when it's 95 degrees out, you don't really want to ride anyway, probably. Stretch your horse.
Right. What a good excuse. Right.
And when it's 0 degrees out, same thing,
Yes.
Spend some time stretching your horse, you'll get warm and they'll be stretched out. But as you're doing your stretches, you start to feel what is different from one side to the other. So let's say a really nice, simple stretch that works for all of us, our busy schedules, is you pick a foot up, you're going to clean clean the foot, right? Most of the time we usually do that, or at least check their feet before we ride.
Mm-hmm.
You pick the foot up. While you're holding the foot, draw a circle 5 times in each direction, as big a circle as you can manage in both directions. And it could be anywhere from a foot to 2 or 3 feet in diameter. As you're doing that, you are moving the entire shoulder muscle and the upper leg muscles. And in 30 seconds, you have just stretched your horse out.
Yes.
If you have a big circle on one side and you have a square on the other side, you know there's a problem.
Yes.
So spend a little time trying to get a circle on that side that had a square, or at least recognize that, okay, that right lead might not go so well today because that right shoulder is just not moving.
Gotcha.
And so you get to actually know your horse, and when you have things that you can never get right, like you do carrot stretches, and you stretch their neck out, and every day you hear a pop, and they don't get any farther than they were the day before. You need a chiropractor. You need somebody professional to help mobilize those joints. And then you keep doing your carrot stretches. Now you can actually do them properly.
Yeah.
And you don't necessarily have to see that chiropractor all the time because you keep up with the soft tissue work in the meantime.
Right. So you're working more on the maintenance program, and you don't have to call them in to fix a challenge at that point.
Right.
Okay.
And you also get to knowing when you do need them, because you'll hit a point where, okay, I can't do my belly lifts anymore because he's gotten really grumpy. Okay, you need to work on those ribs or withers or sternum or something like that. And so they will then, this is part of that listening, they will then start to tell you that something's not right by the fact that, again, they can't do that circle on the one side. They can't bend their neck to the right anymore. Or a great example is they've had a party in the field at night. Somebody crashed and burned.
Yep.
But all you see is mud on them. It's not like they got cut or anything. Somebody just fell on their neck or fell over or who knows what. Did a sliding stop that didn't work. And you get on to go for a ride. You haven't stretched your horse out. And you have a miserable ride. And the horse won't turn, won't pick up his lead. And you're like, yesterday he was really great. And what happened? Well, what happened was a party. And if you did your carrot stretches, you probably would have already known that you were in trouble.
Gotcha.
That something happened during the night, because you go and do your carrot stretches and suddenly this horse who could eat off its hip yesterday can't hardly get to his shoulder. So then your brain says, okay, what happened? And if you can't get the neck loosened up with some carrot stretches, maybe you call your chiropractor or a massage therapist or somebody who's good at releasing the soft tissue. And you get the problem fixed today or, in a week or so, instead of struggling with this new training issue that just came up, that you then spend the next 6 months trying to fix their right bend. Right. And
That seemingly came up out of nowhere, right?
Yes.
Yeah.
Yes.
I make the joke with riders all the time that the 4 biggest lies in horsemanship are all of a sudden, out of nowhere, for no reason, and without warning. Because most of those actually boil down to, I, as a rider, was unaware.
Yeah.
So the stretches and these thoughts, what would you recommend as a minimum? How many times a week as a minimum to really learn where our horse is and to help maintain a state of looseness and relaxation?
Some of that's going to depend on how much you're actually riding and what you're actually demanding in the sport that you're doing in the level. If you're out there working at a high level in whatever your sport is 5 days a week, you need to be doing at least a little bit of stretching every day that you're going to go out and ride. But even if it's just those leg circles and a couple of belly lifts,
Okay.
If you're a much more casual rider, 2 or 3 times a week is fine to keep in touch with them and make sure that everything's going well and that they're able to do all of their stretches. And certainly before, let's say, you ride 2 or 3 days a week, and then on the weekends you might go out and do a bigger ride or go to a show or competition or to a clinic. Those are the days you really want to make sure you're well stretched out.
Okay.
Because you're going to do more and you want to get more back, especially if you're doing something like a clinic. Because if you travel to go to the clinic, I see a lot of horses, they travel to go to a show or a clinic, they're in a strange stall, they lay down and get cast, they play with the horse next to them, and you come out and it's like, my horse was great last week and now I can't do anything.
Yeah.
And if you take that time to stretch them out really well, you would find out, and you might be able to fix them as well.
Right.
Just by getting them all stretched out again.
Right. Okay, so we're talking about stretching. We're talking about potentially at the horse show, right? Which might be different. My horse lives in a pasture at home, so he's got lots of time for mobility and he's walking around, and I come to catch him from the paddock, but he's not standing around waiting for me. He's out with his buddies and he's playing and that sort of thing. Versus the horse that I take to the horse show, and he's standing in the stall, and so he's basically sedentary at that point until I come and interact with him. So when we're talking about stretching, I know myself, because I live so much out, I try to focus quite a bit on my own fitness. I know my stretching goes better after I've had at least a couple minutes of kind of cardio, kind of get the blood flowing a little bit. My muscles are easier to stretch. The blood and the oxygen have gone into the muscles there now, and I'm not trying to stretch cold muscles. What are we looking at with our horses? Are they functioning the same? Are they functioning different? Should we just pull them out of the stall and stretch them, or is there something we should do first to get them ready?
Especially for our horses that are up. The horses that live in, we can start stretching right away. In a perfect world, we would do exactly as you're doing. Get them out, walk them around, 10 or 15 minutes, even if it's 2 or 3 minutes. Walk them around the barn, walk them around the indoor or the outdoor or whatever. But then do our stretches and then do our riding. We live in this real world where, we don't always want to take the time. We don't always think to take the time because we're busy, we're in a rush. And that same thing holds true when you're actually doing your warm up and your warm down. And those horses that are more confined, whether it's short term for a clinic or whether it's daily because it's a show horse, those horses need a lot of time to warm up. 15 or 20 minutes at a walk sounds really boring, especially if you're in a ring.
Right.
But that is really the best thing. And you can try and make that interesting by walking outside of the ring.
Yes.
If you have that ability. But we really do need to get that blood flowing. Most of us are not going to walk for 10 or 15 minutes packed up, come back, stretch our horses out, and then go work. That would be a sort of perfect world scenario.
Okay.
So we live in the real world. So bring them out of the stall and do your grooming, and you can do a very vigorous grooming that will actually get some of the blood flowing.
Gotcha. Okay.
The Brits, for centuries, did what was called strapping, and they had a very hard wad of straw braided up that they actually swung against the horse like it's a very deep massage. And you got a good Brit that knows how to do this. It really gets the circulation going. But you don't have to get that vigorous. But a good curry, and then do your stretches. Never force your stretch and you can stretch a horse straight out of the stall. Just like if you decided one morning that you weren't going to do your couple minutes of cardio before you stretch,
yes,
if you are kind to yourself, you can do your stretches. They may not be quite as effective.
Right. Okay.
But you can do them without hurting yourself.
Yes. And I would keep in mind that I didn't get the blood flowing maybe as adequately as I could have. So I would take more time. I would be a little more empathetic, that it may take a few minutes rather than a few seconds, potentially.
Yeah.
Okay.
And then when you start thinking about that, it's like, well, I could walk for 2 or 3 minutes.
Yeah, I could have just taken that time. Right.
Stretch.
Right. I could have taken that time to get that warm up to happen anyway. Yes.
Yes. So you can, but the idea is that you never force it.
Gotcha.
And it's often, you sort of think about the fact that the horse is bigger than you. And I don't care how big you are or how small your horse is.
Mm-hmm.
Those horses' muscles are still stronger than you are. So if you go to force something, they're going to pull back. They're going to say, ouch.
Mm-hmm.
And at the same time they're pulling back, you have just negated anything you had done previously.
Yes.
Because that muscle is now tight, it's in tension, and the horse is protecting it.
You've negated it both with your stretching and with any of your training at that point.
Yes.
Yeah.
Because they've tightened up against you. They're worried that you're going to force it.
Right.
They're worried that you're going to create pain, that same pain that's in the back of your knees when you bend down and don't warm up.
Yes. Right. Right.
So the biggest secret, the biggest thing is you never force it, and then you can incorporate it into any stage of your riding process.
Mm-hmm.
And it's great to do afterwards as well.
Okay, that was just going to be my next question. Was you mentioned a warm down. Will a stretch afterwards, after we've put in a good work session, is that going to give us more of an adequate, I'll call it a point of reference for where the horse is capable of stretching?
Yes.
Okay.
Because when all those tissues are warmed up, your stretches are going to be larger. They're going to be longer. You're going to have more reach than you would taking the horse out of the stall cold or even after a couple of minutes of warm up.
Because there's more pliability in the warmer muscles.
There's much more pliability, and the benefit of doing it afterwards is that you will then incorporate more stretch into especially the tendons that attach to those muscles. So the muscles are warmed up and pliable, but those tendons are also more pliable. And what you'll see if you do both the before and after is that you will get, let's say a good example of this, because it's easy to measure, is if you take a hind leg and you're stretching it forward, a horse that is well stretched out should be able to touch his knee with his hind foot. And that should not be extremely difficult unless they have a super long back. So you'll find most horses, when you first start stretching them, might stretch halfway forward to that front leg. But if you do it regularly and you do some stretching after they're warmed up, you'll find in a few weeks that they can come almost to that front leg.
Gotcha.
The same sort of thing as going to a yoga class.
Right.
To a yoga class, you can't do all the stretches.
Right.
You do that month after month, and you can do those stretches.
Right. Well, that makes perfect sense, and that's where my mind was going too. Is the yoga classes? We see horses. If there's a fly on the top of their tail, they can reach their neck around and reach all the way back to the back of their tail head.
Absolutely.
But when we're riding, we say, well, this sucker, he's so inflexible, man, I got to rip on his face and poke him in the belly with my spurs and do all this other foolish stuff.
Yep.
Interesting. So when we're talking about the tendons and the ligaments and things like that. So as the muscles warm up, they're easier to stretch. As the body warms up, the tendons are easier to stretch. And the tendons, if I'm correct, the tendons connect the muscles to the bones, correct?
Correct. Yes.
And the ligaments connect bone to bone, right?
Correct.
Okay.
Yeah.
Now, is there a warming and a stretching ability in the ligaments as well?
Yes, there is.
Okay.
It's much less in the sense that they don't have the degree of stretch that a tendon connected to a muscle does. But everything in the body has a natural stretch or a spring to it. And you improve that with warming up and stretching and essentially encouraging those fibers to be long and flexible. So a good example of that goes back to the sprained ankle. Most people who have sprained their ankle, once it's healed, you have some scar tissue in that ankle, and you have some pieces of it that are not very flexible.
Right.
You can actually, with different types of body work, myofascial release, just massage to break up the scar tissue, in many cases, you can actually restore full or almost full motion to that joint, even though that injury could be several years old or 10 years old.
Okay.
So we can do the same thing with our ligaments by stretching and our joint capsules. Everything has to stretch. If we take that hind leg example, and we're stretching the hip forward, and our goal is to touch the back of the knee or the front leg at some point on it, not only do our muscles and tendons have to stretch, but the joint capsule, which is fibrous tissue like a ligament usually, and it's covered with ligaments, those all have to stretch as well. They have to become able to be more like a rubber band. And they really are like a rubber band. So they're like a short, squatty rubber band that doesn't have a lot of give to it. Where the tendons and ligaments are like a long, flexible rubber band that you can pull and stretch and make it 3 times the original size.
Okay.
And a piece of scar tissue is like tying a string inside that rubber band. So if you have scar tissue, whether it's from an injury or bad chiropractic adjustment, or the fact that they slipped and their hip went out to the side one day, out in the field or turning barrels, that scar tissue is then like putting the piece of string into that rubber band. And if you do nothing to it, there'll always be stress where the rubber band attaches to the string. That will be your highest stress point.
Okay, because there wants to be a stretch, but it's limited at that point.
So the easy example to visually see is a horse with a bow tendon. You have a nice piece of string attached to the middle of the tendon, and there's stretch at the top of the tendon and stretch at the bottom of the tendon.
Okay.
And if you do work on that tendon, and this is where I use some homeopathic remedies that will actually take down scar tissue as well, you can actually get a lot of that stretch back into that tendon, which means you're much less likely to re-injure it.
Gotcha. That analogy of the rubber bands was, I hope for our listeners, it was as big of an aha moment as it was for me. That seems like a great visual.
Yeah, it is, and it really helps people get what's happening. And bow tendons are so common that you probably know somebody that's got a horse with a bow tendon, and you can just watch it, and you'll see how the stretch is above and below it.
Yes. So what I'm so tempted to ask now, what sort of homeopathic remedy are we looking at that's going to take away that scar tissue?
my very favorite homeopathic remedy. It's one called silica or silicea.
Okay.
They're both the same. And homeopathy is a science where you take a compound and dilute it way down. And if you give it in a concentrated form, you actually get the problem that you're trying to solve with this in a very dilute form. So the easiest example, because homeopathy is one of the hardest things to understand. So the easiest example is if you have a bee sting, and everybody that's been stung by a bee knows what it looks like, and it's red, it's swollen, the skin is stretched tightly over it, and it's fluid filled, and it usually feels better under cold water. So that's the picture of a bee sting. So we would take, to treat a bee sting with a homeopathic remedy, we would actually take a bee sting that has been diluted and prepared in this homeopathic method, and we would feed it to the horse or the human. And what it's basically doing is putting an imprint of what that problem looks like and telling the body to go heal it. It's an energetic form of medicine. And acupuncture, which people are much more familiar with, is also an energetic form of medicine, in that you're moving some energies throughout the body with needles. In homeopathy, we're telling the body what to do with this very dilute substance that's really the energy of the original thing. So if we gave that bee sting in a concentrated form, we would get a bee sting. So with the remedy silica for the scar tissue, think about if you've ever heard of silicosis of the lungs from people who work in factories where there is stone dust.
Right.
Their lungs become scarred.
Yes.
So in the concentrated form, silica is toxic certainly to the lung tissue, but it creates scar tissue. So in the dilute homeopathic form, we actually can tell the body to break down some of that scar tissue. And it's hard to believe, but it is something that you actually can see. And I had one horse that was a perfect example, and of course, before cell phones, I never took a picture of the before. But this horse had a huge bowed tendon. Huge horse, gigantic bowed tendon. The tendon measured 17 inches around.
Wow.
Yeah, it was big. You walked up to this 17-hand horse, or 16 3-hand horse, and you looked at her tendon because it was so big.
Wow.
So the woman measured it. It was 17 inches around, and 6 or 8 weeks later, it measured 13 inches around. And it looked like a bowed tendon still, but
that's a significant change.
Yeah. So the silica it's a slow change, not a fast change. So the homeopathic remedies you can get at health food stores, and actually you can get them at a lot of regular grocery stores if they have a decent sort of organic vitamin mineral supplement department. I'm seeing homeopathics in many places now.
Interesting.
And so they're little white balls, and they usually have a number after them. I usually use a 30, a C, or an X. And for most things that you would be doing, it doesn't matter whether it says 30C or 30X. And I usually give about 6 or 8 of the little white balls, which looks like nothing if you're used to giving tubes and tubes of medicine.
Right.
But remember, I said this is really dilute medicine, so we don't need to give a lot. And you give it to them on a little handful of food, and with something like silica, twice a week for a month or two, we'll take down the scar tissue slowly over time. It doesn't necessarily make 100% of it disappear, but it takes enough of it down that you can start to get some stretch back into the area that's been damaged.
Okay. This is very interesting, and I've used some homeopathic medicine in the past when one of my legs was broken. Actually, I have a friend who is a homeopath, and really interesting. She's a homeopath and a Reiki practitioner, and she landed me in the emergency room over a blood clot, actually. But that's a story for another time. But so I'm picturing, like, I know what these little balls look like. And I mean, if I were to describe them maybe for our listeners that don't understand them, I would think maybe, so a grain of rice would be about the length of 3 or 4 of these little balls. Does that sound about right?
Yeah, anywhere, depending, they come in different sizes, but yeah, a grain of rice would probably equal either 2 or 3 of those.
Okay. Okay.
At least the most common sizes that you're going to see in the health food store.
Gotcha. Okay. And we're talking about the silica or the silicea, and I'm thinking, my mind goes right away to like the silica packets that come in your new shoes, right, when you buy them.
Right.
Is that the same silica?
It is derived, well, a lot of the silica packets that are in your shoes actually these days aren't even, there's some kind of chemical compound.
Gotcha.
But the ones that are made from minerals are made from a similar kind of a compound. They're processed a little bit differently, but yes, that whole concept originally came from silica is nothing more than sand.
That's what I thought. Okay. Yeah.
So the names that are given to the remedies are the Latin scientific names.
Yes. Okay. Sure.
So our bee sting remedy is called Apis because Apis mellifica is the honeybee.
Yes. Okay.
And silica is sand.
Gotcha. So, and actually, I guess now that we're on this little rabbit trail, which I'm good at getting on in these broadcasts. So if somebody were to tear apart the packet of silica, little balls, silica gel that's in their new shoes, those balls, I'm thinking, are about almost twice the size of the homeopathic remedies.
Yes, and they're not going to do anything if you feed them.
Okay.
Yeah.
Good. Yeah, so stay away from that. I'm just thinking for comparison, gang.
Yeah.
Okay.
And so with homeopathy, what we see are these little white balls, but there's a very specific and very regulated process by which these are made. So they're made in the same process will make silica, whether you buy it from one company or another, or you buy it from Canada, or you buy it from Germany.
Okay.
The process is standardized worldwide.
Gotcha. Okay. And now you said that you use a 30C or a 30X. What's the difference, and what do the numbers mean?
So the numbers are, for most people who have not gotten into homeopathy, the numbers are probably the more important thing to know about. The C and the X, C has to do with centesimal, which means 100 times dilution, or 199 drops of dilution to 1 drop of remedy. And the X means decimal, which is 9 drops to 1 drop. And when you get into treating, when you get seriously into homeopathy, those differences between the X and the C become much more important. You're treating very sick animals and doing very specific things.
Okay.
When you're doing something like this, when you're treating a bruise with arnica, which is a very common remedy that many people may have heard of, it does not matter what the X or C is. It's really going to work about the same in the body.
Gotcha.
The numbers, you'll see a 6, you'll see a 12, you'll see a 30. Canada might see a 9. Sometimes you'll see an 18. Sometimes you'll actually see a D in some of the European countries. But the 6 and the 12 and the 30, those numbers actually are the number of times that a dilution has been made. And there's a dilution and a shaking process between each step.
Okay.
So if it's a 1X or 1C, then it's been diluted 1 drop into your dilution solution, shaken. You take 1 drop of that and put it into your next dilution solution, and you have a 2X or a 2C.
Okay.
You keep doing that till you get to a 30, and then you will see numbers like 200, 1M is 1,000, 10M is 10,000. So you can get many, many of these dilutions, and they get stronger and much more specific in their action as they get in the higher numbers.
Okay. Okay.
Yeah. So you're only going to see in a health food store 30 and below. If you go to a pharmacy, you may see the 200s, and if you go online, you can get any potency that you want from the places that make them.
Okay.
And places like my website that sell them. But the stores are limited to the 30. And
Gotcha.
the 30 is really the best and safest place to get started.
Okay.
And when you get into using the higher potencies, you want to have a homeopath, and there's veterinary homeopaths around the country.
Okay.
And there's some, like myself, do phone consults and things like that as well, because it's medicine, but it's holistic, and it's more, truthfully, it's more taking a history to figure out what to do than it is prescribing.
Okay. Okay.
So some of us do telephone work.
Very
And there
interesting.
are organizations that certify homeopaths, and I guess after this, we could put up some links to the organizations.
Definitely.
So people can find local practitioners.
Definitely. And that's actually a question that's come in. Do you have any recommended study programs for equine homeopathy in the U.S. or even online?
The National Center for Homeopathy had an animal track for a while. I don't believe that's still going on. There are a few of the individual veterinarians will have some courses.
Okay.
Most of these are short courses. There's a veterinarian named Dr. Christina Chambreau, who I think frequently teaches some summertime courses here on the East Coast and actually around the country. We don't have a really good formal training that takes you through from the basics to advanced homeopathy. There's one in England.
Okay.
And we have the veterinary one, but you can only get into that with a veterinary degree, or
Gotcha.
I think they have taken some nurses and doctors as well.
Okay.
So the truth is that there's a lot of similarities. We have people who have taken human homeopathic courses and can learn, so you can certainly learn all the good basic prescribing, because that's the same across all species. It's the chronic diseases where you need a little more specific training.
Okay.
And there is, if you really want to delve into it, there's a book called Homeopathy for Horses by Tim Cousins.
Okay.
And that's a Bible. It's pretty in depth. So if you're not, you may want to start with a more basic book. I have a little first aid book for homeopathy. If you're totally new to it, it's easy to get overwhelmed.
Gotcha.
So the Homeopathy for Horses is if you're ready for more.
Gotcha. Okay. And your book, that's the one titled "The First Aid Guide The First Aid Guide to Homeopathy for Horses." Yes.
Yeah.
Okay.
Yeah, and that's written to be a nice, simple cookbook that you can look at, and you have a few choices because that's that individualization of it. But the choices are quite straightforward.
Gotcha.
So you're able to pick.
Okay.
And be confident.
Okay, so that's a great way to kind of stick your toe in the water at that point.
Mm-hmm.
Okay.
Yeah. And I'll just debunk a couple of, there's a lot of religions out there about homeopathy, and a lot of things that people will tell you you can and can't do with it.
Okay.
And one of them is that you can't touch the pellets, or you can't have them touch anything. One of them is that you can't feed it with food. I've even had somebody that was told by their homeopath that they could only touch glass, so they were putting a shot glass in their horse's mouth.
Oh my.
Yeah.
What? Now I've heard the not touching the pellets part, but those, the rest of that is really oh, wow! I can see that going really wrong.
Yeah. So I've been doing it since 1990, 1991, and I have picked the pellets up off the ground and put them in the horse's mouth. They have been sitting in a envelope in the 90-degree sun next to the horse's stall, so it would get put in the food.
Okay.
My personal homeopathics have been x-rayed by x-ray machines in China and in Africa and all kinds of places, and they still work. So forget all of the craziness around it.
So that stuff's just BS.
Yeah.
The science is the science, and the wacky religion part of it is just out there wackiness.
Yeah, and it's also a really, really good way if you've gotten the wrong remedy and it's not working. You make up all these, oh well, you touched it, that's why it didn't work.
Oh.
Yeah, I've been told things like that. No, you have to admit you got the wrong remedy. It's not the right remedy.
Wow. So that can be a cover-up for just not knowing what the heck they were talking about.
Yeah, and it makes a good story. And I mean, they'll tell you in this country, don't drink coffee and take remedies. And there's 5 remedies.
Well, I'm glad I was never told that.
Yeah. Well, you'll hear that a lot.
Really?
But in Europe, they've used more remedies than we have, and they drink coffee you can stand your spoon up in. So
yes, it's the best.
If you take one of those 5 remedies, the coffee antidote, yeah, it's probably not going to work. But if you take the other 1,000 that coffee doesn't antidote, it won't make any difference. Interesting. Part of the goal with the homeopathic remedy is for it to be absorbed in the mucous membranes in the mouth. And that's probably where some of these religions come from. Okay. But the horse has a long, wet mouth, and they chew their food well. That's the characteristic of a horse eating. So a little handful of food with some remedies on it, you can hear the break up in their teeth. Yes, yes. And by the time it gets to the back of their mouth, it's been broken up and absorbed in those mucous membranes. Okay. You can mix it with water. You can put it, I have people that hollow out carrots and put it in those. There's all kinds of ways. I remember being told by my homeopath whenever I was being treated for my broken leg to just even hold the pellets under my tongue. Yes. And I don't know too many horses that will do that for you, but right. So there goes the idea of the palate, right? Yeah. And so with the horses, that same thing is accomplished by them chewing up some food. Gotcha. Sure. Of course, because okay. But I've even had people, because of barn management issues and things, that have had it put on 3 pounds of food, and I still had the remedies work. So interesting. I try to do it on a little handful of food. Yes. That's, but don't make yourself crazy on any of it. Sure. One of our listeners put in that using it with wine is okay. I remember chatting with the homeopath whenever she had given me the pellets, and she was talking about something about the process that they're diluted in, or the process they're created in. There's some sort of alcohol that's involved in that process. Yeah. And so I remember making the joke, because at the time my leg was broken and I had a bunch of horses in training and I was going crazy, as most trainers do in situations like that. And I said, damn it, I'm just gonna,
dump this bottle of little pellets into my bottle of whiskey and it'll all be good. And she said, well, actually, you can do that.
Yeah. Yeah, and you can even buy remedies. Most of the time, the remedies are sprayed onto the pellets.
Oh, okay.
But most of the process is done using alcohol as a diluent for most things.
Gotcha. Okay.
And then there's that alcohol base is sprayed onto the pellets. It makes it easier to handle. But if you go to the homeopathic pharmacies that manufacture it, a lot of times you can find it in a liquid form from some companies, and it works just as well.
Okay, so then you're putting in droplets rather than pellets.
Right.
Okay.
Put in droplets, and you can mix it with water, you can mix it with wine, you can. If I'm doing it with a cat, I put it in a little bit of milk or broth. So.
Oh, okay. Okay.
It's very durable.
Perfect. That's awesome. I feel like we could have a discussion about each one of these little holistic modalities individually.
Yeah.
This is fascinating stuff to me. I take notes as I'm doing these, and I've got about 7 pages of notes so far just from this conversation. This is fantastic. Awesome. So then,
each modality really and truly is, a day or a weekend or a week's worth of lectures. I mean, you can dive in as deeply as you want. I'll do a lot of saddle fitting clinics that are 2 or 3 hours long, but you can turn around and do a 4-day saddle fitting clinic if you really want to learn the ins and outs.
Right.
With homeopathy, it's sort of a lifetime of study, and you spend a couple of years learning the basics solidly and really learning the remedies.
Gotcha.
The same thing with herbs. I mean, so much that you can do.
Gotcha. And now with the herbs, you said with the herbal medicine, there was Western, European, Chinese, Indian, American Indian. Now, is this based on the herbs that were culturally or geographically available, or is there just a totally different idea with all of these? How does that work?
Both, actually. And what happens is that the herbs for sure were what was available in the area because they didn't have FedEx back then.
Sure.
And so they learned how to use it by what was available. Several fascinating things, though. One is that many of the herbs are actually used for the same thing worldwide, historically. So they recognized the quality and what that herb was good for, whether they were in Australia, because there's some plants that grow pretty much like, say, mint or something grows pretty much worldwide.
Okay.
And so the Australians would have their mint, and the American Indians would have theirs, and the Chinese would have theirs. And they all incorporated it into their system. And part of what sort of should convince the skeptics that there's something to herbal medicine is that independently, all these cultures discovered the same thing and the same action of the herb.
Okay. Which I guess makes perfect sense, right? Because penicillin in Australia is going to work like penicillin in the United States, right?
Exactly.
Okay.
Yeah. And so culturally, though, there are some very large differences in how they went about their herbal medicine and their approach, and that was based on how they thought about medicine and illness. So the Chinese herbal medicine is very much based on the same acupuncture, and they looked very much at whether herbs were warming and cooling, and they had very specific ways that they put their formulas together, and they based them on their Chinese diagnosis. So in a simple example would be, let's say, in the fall weather when weather is changing a lot, we get a horse that's got a mild colic. And in Western medicine, we might say, you know, he's got a bit of a digestive upset. We might say maybe he didn't drink as much water.
Mm-hmm.
In Chinese medicine, they would say that the cold weather invaded the spleen. And so they would give an herb, and it would be the spleen acupuncture meridian. So they would give an herbal formula that would treat that cold invasion of the spleen. That's how they would explain it. But you would probably find some of those same herbs that an American Indian or a European herbalist would put into a colic and gut pain kind of formula. But they would have some other herbs in there that they had picked based on the way they studied medicine.
Gotcha.
And the Ayurvedic or Indians had a system of medicine, and so they would group herbs together that followed that system. And the American Indians would group herbs together that followed their system. And the European and American Indian and sort of American approach is a little bit simpler, and it's often much simpler place to start.
Okay.
If you're interested in learning about herbal medicine, because you don't have to study a whole different set of terminology and way of thinking that you have to do when you're learning Chinese or Ayurvedic.
Okay. And most of that is the cultural difference?
Yes.
Okay.
Yes. And it's how they looked at the world. It's how
Gotcha.
they experienced it, and it's the plants that they had available to them.
Gotcha. So for us Westerners, we would look more to the Western herbal medicine as a base point to start with.
Yes, and I think anybody that's interested in getting started with herbs, it's much simpler to understand.
Okay.
If you try to understand Chinese formulas, I mean, you have 10 formulas or 15 formulas possible for gut pain.
Oh.
And that gets very complicated.
Oh, wow.
So you need to be studying Chinese medicine. Whereas with Western herbal medicine, it's much easier to look at a formula of 3 to 6 to 8 herbs and learn and understand those herbs. And there's a lot of training, and there's a lot of books. Well, I won't say a lot, but there's some really good books. There's a great new book. Let me just read off the title properly. Equine Herbal and Energetics by Stacy Small and Andrea Baldwin. And that's a good, fairly in-depth reference book. The other book that's on the market that's good and a little bit simpler is The Modern Horse Herbal by Hilary Self. She's of Hilton Herbs.
Oh, Hilton Herbs. Okay. I've heard of that book through Hilton Herbs, I believe.
Yeah, and it's a nice, and it just describes the herbs, and it's simple, and it's a good starting point.
Okay.
The Equine Herbal and Energetics right now is our Bible in the equine world as far as in-depth information.
So that one's going to be more intense than the Modern Horse Herbal from Hilton.
Yeah.
Okay.
Yeah.
Okay. Yeah. Very interesting. This stuff, I totally feel like we could do a podcast on each one of these things. So, so I've made a list of these as we've talked about them, and I think we're doing a good job as far as talking about how like the homeopathics work and how the herbals work and the thoughts behind them. What about the essential oils? How does that work?
Okay, that's another one of the branches underneath this holistic umbrella.
Okay.
And the essential oils are a concentrate. So we have the homeopathics that are a very dilute substance.
Okay.
We have the herbs that are more like a drug in the sense that we see them and measure them, you know, a handful of herbs or a teaspoon of herbs or whatever. They're more concrete, if you will.
Okay.
And then we take those herbs and super concentrate them, extract them, and we end up with our essential oils.
Gotcha. So it's the total opposite, basically.
Yes.
Okay.
Yeah, the total opposite. And that's it's worth making a comment here about the herbal supply in the world. There are many herbs that are easy to grow. They're commercially grown. They can be grown organically or non-organically, depending on what you wish to use. And there's no issue with supply. There are herbs that are very hard to cultivate or really don't grow well in cultivation and need to be harvested in the wild. And
Okay.
there are a lot of over-harvesting, and we actually have herbs that are going extinct because, in the
Really?
wild at any rate, because of over-harvesting.
Wow.
And essential oils use tremendous amount of herbs to make an ounce of an essential oil. So there are definitely some quality control issues. Well, there's quality control issues. That's a whole other topic across the board.
That's a whole other podcast, right?
Yeah. But with the essential oils, because you're super concentrating it, it is really important to have quality ingredients. And it's also important that those ingredients are harvested ethically.
Sure.
And I think sandalwood is a good example of, I don't think there is any ethically harvested sandalwood, and yet you will find it being made into essential oils and sold.
Yes.
And something like lavender, you have fields of lavender growing here and all over the world.
Mm-hmm.
So lavender is an easy one to
Gotcha.
grow. But the essential oils work on the basis that our sense of smell is a powerful one of our senses.
Mm-hmm.
And it doesn't take much of the essential oil getting into either our skin or our nose, being absorbed by the body, for it to be a treatment. So a few drops of an essential oil can be a complete treatment for even something the size of a horse.
Oh, okay.
And because these are made from herbs, they have all the healing properties that herbs can have. And there's a lot of misinformation about essential oils. They are a very powerful form of healing. They also can be toxic. And
Okay,
that's
yes.
because they're super concentrated.
Right.
So a lot of our horses will actually have significant skin reactions to essential oils. And many people have already seen that if they buy even just an essential oil fly spray or something like that.
Yes. I know I've had skin reactions myself. I travel with a bunch of essential oils that I use. Basically, I mentioned that to you before we started our broadcast that I basically live on the road. I'm on the road about 345 days of the year, and I have packs of essential oils that I travel with so that every hotel room basically smells the same. So that's the constant in my life. But I believe it may have been peppermint that gave me a really strong red rash, itchy rash reaction on my chest, but doesn't have a reaction if I just sprinkle it, like on a pillow or something like that.
Right. Yeah. The skin is our largest organ. We don't think of it as an organ, but it is. And so it absorbs essential oils, it reacts to essential oils, and we know we have these, especially the redheads, the thin-skinned chestnuts that react to everything. You really have have to be careful. And I'm a redhead, and my skin reacts to some of them too. I have to be very careful.
Okay.
But they do form a fascinating form of medicine, because you can take essential oils, you can take single oils and combinations of oils, and the horses will absolutely pick the ones that they know are good for them, and they will turn their head away and leave if you present them with something that they don't like.
Gotcha. Okay.
And you can believe them. There's a website that's a fabulous resource for veterinary essential oils, which is, it's spelled Animal EO. It's actually Animalio, but it's animaleo.info.
.info. Okay.
And it's run by a veterinarian. And so there's a lot of information about animals and the safety of oils. We have a lot of safety issues with dogs and cats as well. And different species have different toxicities. So if you have things like barn cats, you may have horses that can tolerate certain oils, but the cats cannot. And there are cats that die from essential oils used improperly.
Really?
But
Wow.
used properly, they're fine.
Gotcha.
And you can use oils with cats. So that's a really good resource.
Wow. So that's animaleo.info.
Yeah.
Perfect.
Yeah.
Okay. Good.
And she's got a lot of educational material up on the site for all species of animals, including birds.
Oh wow. Okay.
Yeah.
Okay. So that's leading me to think, and I'd love to touch on a couple of these modalities individually, and I want to be respectful of time as well. But that's leading me to think: could I be mixing essential oils that are not so good to mix? I haven't blown anything up yet, so that's a good thing. That beats my high school chemistry class.
But yes, you can definitely mix things that probably shouldn't be mixed. You won't have to worry about the chemistry of blowing things up. The oils don't usually do that. So
Good.
You're safe there.
Good.
But you can definitely mix things together that enhance what could be a negative effect. So if you have a very warming oil, say like oregano oil,
Okay.
which is a very strong oil,
Yes.
and you add something else to that that's also very warming,
Okay.
your skin or body, or your horse's skin or body, might tolerate the oregano oil by itself, so we usually still need to dilute it to put it directly on the skin. But you mix those two together and you can get a nice burn.
Okay.
Because
Sure.
that's too strong. Having said that, if you're treating, like, essential oils of tea tree and oregano oil are both, they're very good, strong antibacterial, antiviral, antifungal oils. They are great for treating things like thrush and white line disease. And on the foot, you can use them straight.
Okay.
You don't have to dilute them.
Gotcha.
If you use them on the skin, you've got to dilute them.
Okay, interesting. So, and maybe I shouldn't admit this for the whole world to hear, but so when I go into a hotel room, I have a few oils that I will splash into the air conditioner unit. So mixing oils in that case is not going to be bad, right?
No. Oh, no, not at all.
Okay.
And the thing is, those are probably oils that you have found that you like, that work for you.
Exactly.
And you're just diffusing them throughout the air. And
okay.
the truth is that the air actually is full of things like essential oils, especially when you go into the woods. And there's a lot of research that shows, they actually call it woods bathing.
Okay.
And it's a prescribed psychiatric treatment in Japan. That's where they originally sort of came up with the term.
I remember reading about that, actually, now that you mentioned that. Yes, absolutely.
So what they've done is they have figured out that it's not just the being in the woods. The trees actually have essential oils, essential compounds, different chemical compounds coming out of them.
Yes.
And that's what you're actually breathing in.
They did some sort of study on that, and I'm
Mhm.
thinking it was in Japan, on
Yeah.
its effect on suicide, wasn't it?
Yeah. Oh yeah, it's a big psychiatric thing now.
Yeah.
And there's even some. I think there's a park in Chicago that was sort of designated by some of the city psychiatrists, but it helped
Really?
save some of the parks in Japan because it's a medical treatment. You have to go on.
Yeah. Right. Right.
But part of that is because the actual research shows that it's because the trees are giving off these oils. So by doing that in your hotel room, you read about on the site the different ways of giving oils, from sort of patting them on the skin to a diffuser, and you can buy these diffusers that mix with water and they put out like a little steam with the essential oil in it. And what you're doing is basically air diffusing it. You're just passing air over it and sending that out into the room.
Okay.
And that's a great thing to do. And it makes your hotel room probably much healthier for you.
Awesome. Well, I know it helps me with regular sleep patterns, because I'm in a different hotel almost. I would say most nights of the week I'm in a different hotel. But I think the max I stay in a hotel is 4 solid nights. So I found things like lavender, of course, is a base. Cedar wood is one. Patchouli happens to be one of my favorites that I find also very helpful with little pesky gnats if I'm teaching in an area that has a lot of those. And occasionally during the day, then I'll do eucalyptus and peppermint also with that. So I travel with a case of them that I splash around at random.
And then the nice thing is that they are very compact, and that it's easy to do something like that, to travel. Homeopathics are also really compact, so you can carry a kit with your essential oils and some homeopathics, and you can do amazing things.
That's really interesting. That's really interesting. Okay, so moving on. So we all kind of have a pretty good idea of how chiropractic works. Now, this part was interesting. You mentioned at the beginning physical therapy for horses and how it's considered holistic for horses, yet conventional for us. Where's the shift there? What's the problem with that?
I think the biggest problem with that is that until really quite recently, there was no training for veterinary physical therapy people, and for the last sort of, and even now, there are a lot of people running around with all kinds of machines calling themselves physical therapists. And there are very few true veterinary physical therapists. And I think that's why it gets lumped, because somebody will have a laser and they run around and treat animals, and somebody else will have a pulse electromagnetic wave thing and they run around and treat animals. And when you have a hammer, everything looks like a nail. So if you have somebody who's really trained in physical therapy, you look at the patient and you go, okay, we need a laser here, an electrical stim machine here, some tape, and we need 20 minutes of exercise 5 times a day. That would be a physical therapist.
So that's a little more the integrative approach there.
Yes.
Okay.
And so in the human world, I would say 15 years ago, maybe 20 years ago, the sports medicine physicians, who were really the cutting edge of the surgeons and the people who, you get a football player that trashes his knee and 6 weeks later they're back on the field playing.
Right, exactly. I want to know what that guy knows.
Yeah, exactly. And so what those guys are doing to make that happen is, yes, they do the piece of surgery, but even a lousy knee surgeon these days should have you waking up in a machine that's already bending your knee and doing the physical therapy that you aren't even ready to do yet. The hip replacement people right now, you wake up from anesthesia and they're like, okay, get up and go to the bathroom.
Yeah, right,
You're like,
right. Right. More almost feels like more the tough love approach, right? Like get up and go to work, man.
Yeah. And so what they have found through, it was the sports medicine guys that figured it all out, is maximize the PT, do your surgery, do whatever you need to put something back together, but the real healing is coming from PT. So
Okay.
they have advanced physical therapy for the athletes. And we have stayed in the dark ages, and we stick a horse in a stall for 6 weeks, and then we hand walk it for 10 minutes a day, and we call that physical therapy.
I am so glad to hear you say that, because that's something that I've been wondering for quite a while, is why are we so far behind?
Well, I would love to know the answer to that.
I mean, even things like, you think about video coaching. How long have we been doing video coaching for athletes that now it's finally in the last 2 to 3 years becoming more popular for riders?
Yeah. No, I don't know.
Okay.
There is a lot of tradition in the horse world.
Yeah. So we're just slow to accept it.
Yes, and there are some logistic issues.
Okay.
There are physical therapy program for a horse takes time.
Gotcha. Okay.
It takes effort.
Mm-hmm.
It often takes some skill. So if you say, let's say you've decided that you have a tendon and it needs to be taped, and you want the laser once a day and say some PRP injected. So the vet comes in, does the PRP. Well, the laser then has to be done by either somebody in the barn who is trained, by the veterinarian who's not going to show up every day to do a 20-minute treatment.
Right.
By the technician who probably also isn't going to show up at the barn every day.
Sure.
And so then to build, as one of the things that I thought back in the late 80s and stuff, that I'd love to have a huge rehab center. Well, the finances behind these big rehab centers don't work. So there's very few of them around.
Okay.
So because the intensity of, a lot of it is the intensity of the labor.
Gotcha.
Hand walking a horse, because you can't tell the horse to go out and take a walk for 15 minutes 4 times a day. That person has to be leading the horse for 15 minutes 4 times a day.
Gotcha. Okay.
And there has not been a lot of education for these people. There is out of Tennessee now a physical therapy course, and there's a whole physical therapy organization now for the veterinarians, but they're also incorporating non-veterinarians into it. And it's a drop in the bucket.
So it comes down really to accessibility then, right?
It comes down to acceptability. It comes down to the larger practices recognizing that this would actually be an enhancement, and then having enough qualified people to be hired. And to me, any practice that has more than 3 or 4 vets could probably keep a physical therapist working full time, but they don't recognize that every single tendon could be healed faster and better if you had good physical therapy.
So they haven't found yet the value in that.
Right.
Okay. Which
and
makes
part of that, I think, is
sense.
because the quality of people they've had access to has not been great.
Right.
So if you can't blame them if they don't have anybody they can trust, then
right. Exactly. That makes perfect sense. Interesting. Very interesting. Well, I'm glad to hear that there's becoming more resources for that, because we've known physical therapy for humans for how long? How long? And it makes perfect sense. A body, muscles are muscles, tendons are tendons, bones are bones.
Exactly.
So it makes perfect sense that physical therapy, whether it's a human or a dog or a horse or a camel or an octopus, right? Physical therapy is going to have the effects that physical therapy has. across the species.
And the dog physical therapists have left us standing in the dust.
Really?
And, oh yes, you can now get decent dog physical therapy in probably around almost every major city. And part of that is because you can have a water treadmill, you can have the ultrasounds, the lasers, the this, that, and the other machine, all right there in a standard office size building.
Sure, because what they're treating is so much smaller.
It's so much smaller. I mean, a water treadmill would fit in my office.
Right.
Without any problem.
Right.
And then the clients can bring the dog easily.
Yes.
Once a week or however often that needs to happen. And then they can practice swimming at home in the bathtub.
Oh, sure. Okay. Right.
So the whole thing is physically so much easier to do. So in the last 5 to 8 years, that has taken off in the small animal world, and we're still in the dark ages.
It's interesting.
I mean, every day I get these cases where it's a tendon, and it's like, well, it's in the stall for 30 days, and then we'll start with 10 minutes walking, and that tendon should be moving as soon as the horse is able to. If it's super painful, obviously he's going to have to be in for a few days, but otherwise, that 10 minutes of worth of walking should start right away, and it should be increased, and in 30 days you're probably doing 30 minutes of walking.
Interesting. And so then the treatment, of course, is going to depend on the availability of the therapy and the practitioner. So if the only person you have as a physical therapist is the owner, you can only prescribe what the owner's capable of replicating.
And there certainly there's some lease programs for things like lasers. I mean, the average owner is not going to buy a $5,000 laser.
Sure.
But to lease it for, 3 months for a treatment, that becomes something that's doable. And things like lasers are very doable by the owner. They, have the interest.
Yes.
It's perfect. There are.
Yeah, it's basically just touching them with the little apparatus, isn't it?
Yeah, and following the instructions and not doing too much, and it's not a complicated thing to do. Okay. And there are many people that are very dedicated and can do an excellent job. Not a problem. Gotcha. But even the simple thing of walking, and a simple program for any rehab is to usually start with 5 or 10 minutes of walking, depending on what the injury was and what stage of healing. Sometimes I don't see it until it's a month out.
Sure. Okay. Right.
Just because I'm not the primary care veterinarian. Usually I'm the secondary.
Well, and I would imagine also because oftentimes it takes us a while to realize there's an actual problem, right?
Sometimes, yeah.
Yeah.
And sometimes you don't realize that there's something different you could do. The vet says 30 days in the stall. And they kind of put the fear of God into you that says you've got to keep this horse confined. And some horses are actually worse off confined because they fret.
Yes, that's always been my thought, that fretting in a stall is way worse than chilling out in a paddock.
Exactly.
Yeah.
So the simplest physical therapy that everybody can do is starting with 5 or 10 minutes of walking, and about every 3 to 4 days, add another 5 minutes. Okay. And if you've done the gym thing, you know that you don't go into the gym every day and work on the same muscles.
Right, exactly.
What you do is you stress the muscles. Let's say you do the upper body one day.
Mm-hmm.
You're stressing those muscles. You're actually tearing things down a little bit.
Mm-hmm.
You're telling the body you better get stronger.
Right. Those micro tears, right, that you talked about.
Yeah, micro tears. Yeah, little tiny, just basically stress tears.
Yes.
And the body goes, oh, okay. And it comes in and it puts down the building blocks, and 2 days later you come back and you can lift another pound or you can do another rep. That's how fast the muscle can change. So with a horse, that 3 or 4 days, especially with an injury recovery, it gives enough time to stress the injury, let it heal and be stronger, and then come along 3 or 4 days later, stress it again mildly, extra 5 minutes, let it rebuild stronger. And if at any point in time in there the horse seems like that bothers it, you just back down. Maybe stay at that level for a week, and then you go up. But in that way, you are asking the body to participate in the healing and to get busy.
Okay.
And to not lay down stiff scar tissue. Because if you lay down that stiff scar tissue, like on the bow tendon, standing in the stall, it's more like 20 and 30 years ago when you had a knee injury, you got your leg put in a straight cast for 6 weeks or even longer sometimes, and then it took you 2 years to get 80% of your bend back.
Yeah.
2 years and a lot of painful physical therapy. So now you wake up with your leg in a knee bending machine, and you never lose your mobility of your knee.
Gotcha.
So with the tendon, if you stand it still in the stall for 30 days, it has not healed in motion. It has healed stiff.
Yes.
And then you have to start to break it down. So your whole healing process is longer and it's not as good.
So you're starting from square -1 instead of from square 0. And isn't it the global muscles at 3 days of unuse start to atrophy?
Well, humans are way worse than horses.
Okay.
The oxidative enzymes start to decrease rapidly in people. So you go on vacation for a week and sit on the beach, and you come back and ride your horse, and your legs are sore, and you're like,
yeah,
it's only gone a week.
Right.
Horses, their actual enzymes. Are you still there?
Yep.
Oh, okay. I just suddenly went quiet.
Oh.
The actual enzymes of the horses don't decrease in the 30 days that they're standing in a stall. They're aerobic enzymes. So they can come out of stall rest, and actually some of them run really good races because they're not so sore.
Gotcha. Okay.
And that's a little bit of difference between, a muscle is still a muscle, but the aerobic enzymes of a horse are more long-lasting than us humans.
So then that's more a chemical difference than a muscular difference.
Yes.
Okay.
Yeah.
Okay. Interesting. I feel like we could talk about this stuff forever. So looking through my list of things that we mentioned here, so acupuncture, how does that piece work?
Acupuncture is a extremely useful piece of treatment for horses, especially our performance horses. Acupuncture is, the idea behind acupuncture is that you have this energy system in the body. It's called chi, and it's really the difference between being alive and dead. So if I lie down and die right now, my body's still here, but there's no chi left. So the Chinese have learned that the chi flows through the body in pathways, like our blood flows through in blood vessels, and our nerves flow through with electricity. And we can see and feel the nerves and electricity and the blood just by cutting your finger. The chi we can't really see, but it is actually viewable through temperature changes in the skin.
And this chi that's the Chinese reference, yes?
That's the chi, yeah, the chi is the Chinese
and
reference.
So Japanese reference is ki, am I right?
Well, they can say ki. The chiropractors will call it an innate intelligence.
Okay.
The homeopaths call it the vital force. So
I'm reminded right now of the Jim Henson movie Dark Crystal, where they talk about sucking out the vital essence of the people.
Yeah.
So that's the gist of what we're talking about. So now, what about this idea that energy cannot be created or destroyed but passed on? How does that work?
Well, with acupuncture, all you're doing is moving it.
Ah, okay.
And with homeopathy, you're really, again, moving it. You're telling it where to go.
Yes.
If you get into quantum physics, which is really starting to explain how quantum physics and now nanoparticle research is starting to explain how some of these really what we've called energetic things actually have physical, they can make physical changes.
Okay.
They've showed how nanoparticles can change the DNA, and that's essentially like a homeopathic remedy.
Oh, okay.
So in quantum physics, yes, you don't create or eliminate energy. It's going to go somewhere.
Gotcha.
It may change form.
Gotcha.
And with acupuncture, we're going to put a needle in. It's like turning a dimmer switch on or off. If that point is blocked, it's like having a dimmer switch turned down. If that point is flowing, then it's like turning that dimmer switch back on. So the needles are that turning of the switch. And you can do it with acupressure, you can do it with a laser, you can stimulate that point.
Okay.
To open the gates, essentially, and let the energy flow freely. Stuck energy is painful.
Okay.
So back pain is stuck energy.
Yes.
That may be caused by a bad fitting saddle, it might be caused by a chiropractic issue, but it is still pain and it is still stuck energy.
Okay.
Along with that stuck energy, you often have a decreased blood flow. So you'll have muscles that are kind of hard and tight, and that's painful.
So the decreased blood flow is because of the decreased mobility because of the stuck energy, yes?
Stuck energy, yes, and decreased mobility of the blood. Muscle tension actually squeezes some of the blood out, so you don't have blood flowing nicely through all the capillaries.
Okay. So a tight muscle is constricted and the blood can't flow as easily.
Right.
Okay.
So you can actually look at a horse with pain with a thermography machine, and thermography looks at the skin temperature.
Yes, okay.
And we tend to look for hot places because we can treat those with an anti-inflammatory. But you can have just as many or worse cold places where there's not much blood flowing.
Okay, so a very good friend of mine does saddle fitting with a thermography scanner. So that would be very similar then. Hot places and cold places, both affecting equally. Okay.
And they need to be interpreted with the cold. And part of the problem a lot of the time using thermography in the saddle fitting can be the evaporation from the sweat, because that will cool.
Okay.
So
interesting.
You have to really watch when you're doing thermography well, you need to watch your ambient temperature and your amount of sweat. And, just a breeze across the damp surface, you can feel it evaporating.
Okay, right, sure.
And as it evaporates, it cools.
Yes.
So the acupuncture is going to open up the flow of the energy, relieve the pain, and that at the same time will help increase your blood flow or decrease it, depending on whether you have inflammation or you have cold.
Okay.
So the nice thing with acupuncture is it's very regulatory. If it needs more energy going to an area, it's going to send more. If it needs less, it's going to actually slow it down.
Gotcha. Okay.
So it's like that, the dimmer switch, when it's partially closed, yes, there's still energy getting through, but it starts to back up behind it.
Okay. Oh, right. Okay.
See? Or like opening and shutting a gate.
Yes.
If you open a gate, across a little stream.
Yes.
If you close that gate, the water starts to back up.
Yes.
And you open the gate part way, some of the water goes through.
Yes.
Open the gate all the way, the water can flow.
Yes. And then it becomes more regular. So my mind, of course, because I spend so much time on the road, goes to traffic patterns.
Yes.
And there's there's a red light at the exit, and that's why I'm sitting a mile back on the highway. Yeah.
Yeah.
Okay.
And stagnation of energy. I mean, what creates a traffic slowdown? sometimes there's nothing there.
Yes, exactly, which drives me crazy. But yeah, it's because the guy in the white Ford Taurus decided to look to the left and read the billboard, right?
Yeah.
3 miles ago, and so now everybody's backed up.
Yeah. So that's your stagnation of energy, and
Okay.
if you could put a giant acupuncture needle in the middle of that traffic jam, it would probably do a world of good.
Yeah, well, yeah, absolutely. Me and my road rage have thought about putting needles in plenty of places.
Yeah. So then you put those in your liver acupuncture meridian, because that's where your road rage comes from.
Oh.
So the meridians, then we have the chi flowing for the body pain.
Okay.
And that's what acupuncture is best known for, is relief musculoskeletal pain.
Okay.
And it does a fabulous job at that, and quickly. Horses are so responsive to acupuncture. And, they go out in the field and they don't have a to-do list and they don't have a traffic jam, and they just go out in the field and they go, I feel great. But we have these acupuncture meridians or pathways, and each one of those is actually connected to an internal organ, liver, heart, lung, kidney, and they're all named for those organs.
Okay.
And the organs, we can treat the organ with acupuncture from the acupuncture point, and you can actually treat heart disease, you can treat kidney disease, you can treat liver disease, you can treat the abdomen, and in the horse world, probably number 2 thing that we treat with acupuncture would be gut problems. A colic, you can actually stop. You can't stop a twisted gut, but you can stop a simple colic with acupuncture.
And you can do that. You can affect that with acupressure also, right? Through what do they call it? The triple heater meridian at the base of the ear.
Yes.
Okay.
And like the T-touch ear work.
Yeah. Right.
And what you're really doing with the Linda Tellington-Jones T-touch ear work is you're integrating on the ear our acupuncture points for your whole body. So
Okay.
it is actually possible to have ear acupuncture to treat your liver.
Oh.
And so when you're doing that type of massage from the base out to the tip, you're integrating all the acupuncture meridians and kind of getting things moving again.
So you're opening all the pathways.
You're opening all the pathways. And if you're working just the base of the ear, you're opening some of the pathways.
Gotcha. And I know through Linda's work that I've studied for several years, she talks about digestion, respiration, and reproduction at the triple heater meridian there at the base of the ear.
Yep.
Interesting.
Yeah.
Wow.
And so we can treat liver disease, and very often if we're treating internal medicine types of things, it's in conjunction with some herbs or some other form of treatment at the same time. But it is a very powerful adjunct to all of that.
That's very interesting.
Great for post-surgical, to get the digestive tract going again after a colic.
Okay. That's very interesting. So now that brings me to a question with the acupuncture that I've had in the back of my mind for, I don't know, maybe about 2 years now. There's a barn that I teach at in New York, and they have a veterinary chiropractor and a veterinary acupuncturist. She's both in the same, as far as I know. And she says, it's very interesting. She tells me when I see her, she says, I can always tell when you've been here based on the acupuncture hotspots with the horses.
Is that a good thing or a bad thing?
Well, it's a good thing. It's a good thing. She says it's always a much easier process, and they always need less when you have been here. And she said up to a few days after I've left.
Yep.
So I've always been curious, and now I feel like you can translate this for me. What the hell is she talking about?
So what's happening is by moving the horses, by releasing tension, it goes back to our tissue discussion at the beginning.
Okay.
By relieving tension, by moving the body, you are moving the chi. And so I can tell when I touch a horse the next time whether people have been doing their stretches or not.
Right.
Because that tissue is moving. There's an aspect of Chinese medicine incorporates acupuncture, herbal medicine, massage. Their massage is very chiropractic and very deep.
Okay.
And food therapy, and something called qigong.
Okay.
And qigong is one of the there's many martial arts which have lots of healing properties, but qigong is very often mostly more in the medical aspect.
Okay.
And the idea behind qigong is movement.
Yes.
It's healing the body through movement. So qigong can happen. You don't have to do a precise like Tai Chi form that looks perfect.
Okay.
Qigong is about fluid motion throughout the entire body. So if you come in and you get them moving, using their rib cage, moving their body around in a healthier, relaxed way,
okay,
you've just done some qigong.
And there's a breath work involved in that also. Am I right? Okay.
Yeah.
Okay.
And so you get horses to relax, you get horses to breathe, you get horses to move, you get humans to relax, to breathe, to move.
Gotcha.
And absolutely.
So opening the energy. And that's very interesting because I talk all the time about, and some of my students are probably sick of hearing this, but I talk about how the spine is like a garden hose, and if there's a kink in the spine, the water can't flow through the garden hose, so we work to release the kink.
Yes. That's a great analogy.
Okay. So now that's going to take me to another question and another modality, I think. I had an osteopath watch a clinic a year and a half or so ago, and her comment was, you know what you're actually teaching is osteopathy in motion. So what's the osteopathy? I'm so glad that I have somebody here that can translate this stuff for me. What was she talking about? What does that mean?
So, again, we're actually going to go right back to the beginning. Move that soft tissue. Stretch that body. Move those joints.
Okay.
All of these modalities, whether it's massage, whether it's stretching, whether it's chiropractic, whether it's acupuncture, whether it's whatever it is that we are doing that is moving these joints and moving the flow of blood, moving the energy. In many ways, we're all doing the same thing, but we're coming at it from our base of learning.
Okay.
So your base of learning and knowledge is from the training and riding aspect. My base of learning and knowledge comes from the chiropractic and the acupuncture direction.
Yes.
The osteopaths come from learning osteopathy, which is, you can put chiropractors and osteopaths in the room and they can piss at each other. And there are techniques that the osteopaths do a little bit more with some of the internal organs, with manipulating those and moving them around than many of the chiropractors. But the ultimate goal is the same thing, is to restore motion to the joints, to the muscles, to the tendons, to the ligaments. Okay.
Which is what every different modality is aiming for, right? Really, right?
Yes.
Okay.
Yes. And so we come at it from so many different angles, and you'll see massage techniques. There's a gazillion different bodywork techniques, and there are people who have, they've come up with certification courses in their technique, and somebody else has a certification course in their technique, and ultimately, it's just different ways of approaching the same thing.
Gotcha.
And you can't necessarily, there are people who will say my way is the only way, but the reality is that there are so many ways to get to the same point.
So I'm so glad that you touched on that. My way is the only way. So that's like to me, when I hear somebody say that, I go back to that idea, all roads lead to Rome, right? But at the same time, you can drive up and down I-95 from Florida to Maine, and you're never going to get a mile closer to California. Right? So my way is the only way is ego and BS. Okay.
Yeah.
Okay. Because all of these ideas are working for the same idea, and we had a question come in about how do these various modalities support the emotional health of the horses, and to that I think all the time about how if the spine is not right, the feet can't be right. If the body's not right, the mind, of course, is not going to be right also, because within the biomechanical truths, within the within the anatomy of the horse, if those things aren't working properly, then the emotional state is going to be altered, just like us. Like I'm going to go back to when my legs were broken. I was kind of an asshole, right? I was an emotional wreck, so I was really crabby. I was a jerk, but it was because my body felt like crap, right? That caused
your
me.
liver meridian was pissed off.
If I'd have known what that was at the time, I may have been able to address it. The only thing I've ever done to my liver when I've been angry is supply it with alcohol to process.
Yes. Which just feeds that liver meridian.
Which, yeah, that doesn't help, does it?
Doesn't necessarily help.
Suddenly this has become a very therapeutic conversation for me.
Yeah, you understand.
Yeah.
And that liver meridian is kind of important. And the liver meridian, the liver acupuncture meridian is actually our stress meridian. And it's a really good meridian to pay attention to, because as a meridian, its job is to move the energy of blood and nourish the whole body, to take care of the feet and to take care of the tendons and ligaments.
Okay.
So when it can't move, then it gets pissed off.
Okay.
So the emotions that you were feeling from that and the frustration is that liver meridian stagnating, which is like trying to drive your car without oil.
Yeah.
Doesn't work well. And it gets hot. And when it gets hot, then it cooks things nearby. So what's closest to the liver is the stomach. So our stress organ is the liver. So animals are stressed. What do we have? Ulcers.
Yeah,
so
okay.
It's really the liver meridian getting anxious and hot that is ending up giving us a lot of our ulcers. So if we look at it from a Chinese perspective, we have a horse that is constantly coming up with ulcers. We're actually going to be treating the liver as well as the gut.
Gotcha. So that's just as much anxiety as digestive.
Well, and you can look at the different emotions are connected. There's so many ways to look at the emotional aspects of the individual, because each acupuncture, the simplest way I often find to understand something is to actually look at it from the Chinese perspective, and then you can treat it however you want it. You can treat it herbally or homeopathically or conventionally, but you can actually understand the steps of the process more easily sometimes by the Chinese method.
Okay.
So each meridian pair has an emotion attached to it. It has a season of the year. It has a personality type. It has a lot of different things, colors and all kinds of stuff attached to it. So that liver meridian, since we're picking on that, and I think it's a huge one for horses, because horses are made to move. the liver meridian's job is to move. So the more we confine horses, and confinement can be a paddock. I mean, in nature, they're out on 10,000 acres.
Right.
So one horse might be fine in a paddock, another horse might be totally stressed.
Yeah. So it's their personal idea of confinement.
Mm-hmm.
Okay.
Right.
Okay.
And the emotions for the horse are very personal and very individual. So you have one horse that totally stresses out if you move its pasture mate to a different field.
Yes. Right.
That horse thinks the world has just ended. And you can have another horse that you can put on the road, and maybe after a month on the road, they're starting to show some signs of stress.
Yeah, right.
And everything in between. So the idea of getting to know your horse and paying attention and listening is, okay, what does stress my horse?
Mm-hmm.
And then what happens to my horse when they get stressed? The horses with the kind of liver wood personality, because there's these elements that are associated with each different type of personality. The liver meridian is the season of the spring, the element of wood, and it likes to move and work. The border collie of the horse world.
Okay. Yep.
The emotion associated with that is anger. So, when the liver can't move, it gets mad.
Okay.
And it has a very strong opinion about life. So, it's going to let you know. So, if you walk down the shed row at a racing barn where the horses don't get to get out, they're young, and they're usually, or the good ones certainly have a bit of that workaholic attitude.
Mm-hmm.
They're going to eat your shoulder off as you walk past.
Right. They're going to be the dragons in the stall.
Yeah, they are. I mean, they're going to come up with every bad habit. They're going to be trying to move.
Right.
And what are they going to end up doing to themselves if they can't move? Well, what is a racetrack but tendons and ligament injuries?
Yes. Right.
Bad behavior.
Yes.
But bad behavior in an unpleasant way.
Right. It's so interesting that you bring this up, because I can remember a horse I grew up with as a child who taught me so much, who was actually that and then some. He became a self-mutilator.
Yes. Yep.
And I've actually not since met a horse as challenging as he was. But so that makes perfect sense with all these things that were going on.
Yes.
Very interesting.
Yeah. So each horse then has their sort of natural emotional state. Okay. The fire horse is like the chestnut thoroughbred mare bouncing off the walls. You have to ride her with a feather. Mm-hmm. And if you try to, muscle her or be wood against her, she'd go up in flames.
So wood and fire are two of those different elements.
Yes, that's another element. So the basic elements of the personalities, the wood is our workaholic, the fire is our chestnut thoroughbred mare. They're sweet and loving horses when they're balanced, but when they're unbalanced, they're fire.
Gotcha.
Just think about what fire looks like. It's all over the place.
Right.
Then you have earth. Everybody wants an earth horse. You can do anything to an earth horse. Solid, salt of the earth, easygoing. Okay. Unflappable, loves people, doesn't care if they work. They're willing to work, but if they don't have to work, it's no big deal. The wood horse, if it doesn't have to work, it's a big deal. Yes. You're going to know about it. Right. The barn's going to know about it. Right. And you have to lay that horse up. It's really challenging. The earth horse, okay, I'm laid up. No big deal. Okay. The metal horse is a very nice, easygoing, pleasant kind of horse, but don't bring him flowers. Don't cuddle him. Brush the tack area off if you must.
So he's a little more pragmatic.
Very pragmatic.
Okay.
Yeah. very happy, easy to work. Nice kind of horse to have, but not if you want something to fuss over, because they will literally roll their eyes.
Gotcha.
Yeah.
So he's straight and to the point.
Straight and to the point. Let's go out and work.
Interesting.
Throw the saddle on. Let's go. Tie me to the side of the truck for the afternoon. I don't care. As long as we're working or doing something.
Gotcha.
And the water horses are not super common, which is good. Because if you think about water has no boundaries. Water has no direction. Water is all over the place. And the emotion associated with water is fear. So you have this fearful horse with no edges, no boundaries, no direction. So as a rider, you have to be kind and gentle boundaries, because you don't want to get the fear going. Very complicated horses. And
so that's a harder horse to work with than a fire horse.
Yes.
Okay.
A fire horse, if you're a very strong, dominant personality, can be very hard to work with. But a fire horse in the right hands is easy to work with.
Gotcha.
A water horse, it really takes some skill as a horse person to really figure them out. And
so for that water horse, you need to be the banks of the river.
You need to be the banks of the river. Yep.
Okay.
And just guiding it and being there and being solid, but you can't be rough, because that will scare them away. So with those kind of basic personality types, you can have all kinds of combinations. So you can have a little bit of water in a horse, but it won't be all water.
Okay.
You can have some wood and you can have some earth. So you can have a horse that really likes its job, but also has a laid-back side where they can just hang out. So that's a way of kind of looking at the emotional side, that there are these different types. And then you can go about treating the imbalances of those types, either from a Chinese perspective. One of the biggest things for treating the imbalance is just removing the source of pain.
Sure.
So pain is always going to bring out the worst sides of the personality. So if you have a wood horse who's in pain, you may find yourself sitting on the ground a good bit.
Okay.
Because they're just not going to tolerate it, or they're going to bully through you, or they're going to buck, or they're going to kick, or they're going to be unpleasant in some way.
Right.
Take away the pain, you still have the strong personality, but you have a horse that's like, okay, let's go work.
Okay,
Give me a bigger jump to jump.
Yep.
Give me 8 hours on the couch today. I don't care.
Gotcha.
And the fire horse that's painful, they're crazy. So you can take away the pain, and then you see what the true personality of your horse is. If it's a fire horse, it's still going to be light and airy and fiery, but it's going to be happy and balanced, and
gotcha.
You just have to do the things that its fiery brain likes to do.
That's a fire in the fire pit rather than a forest fire.
Burning out of control.
Right. Okay.
So you can also then come at them, because you definitely get horses that the horse is a flight animal. Well, the panther is not sitting up there ready to eat him.
Right.
So he doesn't have to be jumping out of his skin as he goes around every corner. So there are horses that, even though you know that the saddle is fitting right, that they're not in pain, that they're still worried about every troll that's underneath every rock, and every goblin that's sitting in the left-hand corner of the arena. And so then you can work with those horses from a homeopathic perspective. There's a lot of really good mental things that you can do homeopathically, because we have a lot of remedies that have very, very strong mental behaviors. And so we can look at extreme fear. We can look at, anger. We can look at horses that hate to be touched. We can look at a lot of things and treat them from a homeopathic perspective. We can look at, a lot. One of the big questions in the behavior thing is, how do I keep my horse quiet while I'm in the show ring or wherever?
Mm-hmm.
The first thing is turn it out.
Mm-hmm.
The second thing is don't feed it sugary food.
Right.
The third thing is make sure that it's got, no pain. And then we can start talking about herbal formulas, homeopathic things. The new thing that's coming down the pike is hemp, from the cannabis side of things with the cannabinoids.
Okay.
And
Interesting to me how that's very similar with people. Make sure they're out there being functional. Make sure you're not feeding them junk. Make sure the body doesn't hurt. And then we can actually talk about what's wrong with them.
Yes. It's the same for
Yeah.
everybody.
Yeah.
The dogs that are eating the furniture because they're home all day long.
Yeah. Right.
The
Right.
liver meridian is not happy.
Right. Right. So it doesn't matter what body that person happens to be in.
Right.
Yeah.
Right. And it's going to be more the earth personality, whether it's the earth dog or the earth horse or the earth person. If they're locked up in bed with a broken leg, okay, well, I'm just going to watch TV for a while, It's okay.
Okay. Sure. Right. They're gonna handle it
Bring me
differently.
some more chocolate.
Yes.
People like to eat.
Yes.
Whereas you're sitting there, chomping at the bit and ready to leave the hospital bed tomorrow.
Right. Exactly.
Your earth, your liver meridian is saying, get me out of here.
Right.
The earth person still has that liver meridian, and at some point it's going to tweak and just say, I can't do this anymore. But it's going to be happy sitting there in their hospital bed a whole lot longer.
Okay. Right. Right.
So, and the same thing with the horses. I mean, you can sometimes lay a horse up for 10 days pretty easily, but after 30 days, they're ready to tear the whole barn down.
Yes, of
The
course.
earth horse after 30 days is like, whatever.
Gotcha.
No, they're not worried about it.
Okay.
So there are many herbal formulas. Many herbs are very beneficial towards the anxiety. And the truth is that some of these horses can't be out as much as they would like or as they need.
Right.
A lot of our obese horses with all the laminitis problems, we physically can't turn them out in a 50-acre field. They would be dead.
Right.
So confinement happens for many, many different reasons. If you live out west, there isn't a 50-acre pasture like I have out, in farms around here.
Absolutely. It's easy to have grass to their knees where you and I are from.
Yeah.
Whereas you're not going to find that in a lot of other areas.
Yeah. And basically the far west, it takes, 500 acres to raise one cow. So
Yeah.
if you're going to put horses out, you have to have a 10,000-acre ranch. You can't even find your horse when you want to ride.
Right.
And so it just isn't practical. So the horses are in extreme confinement because there isn't any pasture. And yes, they can adapt to it, but that's where we often have to actually help them. And that's where herbs that are anti-anxiety, herbs that are calming, and sometimes we have to experiment to see exactly which formulas are going to work for different horses, because the reasons behind the anxiety can be very different. So it can be that meridian that is just so pissed off at being in, but it can also be the horse that is just plain bored out of his mind, and he's looking for any excuse to be a horse.
Yeah.
And from the biochemical perspective, I mean, even humans who can describe exactly what their anxiety feels like, you still don't necessarily hit on exactly the right formula or homeopathic remedy the first time. You have to figure out what that individual needs.
Okay.
And there are some really great herbal formulas, and the the CBD hemp products get used, or another anti-anxiety. Hilton Herb came out with a certified non-testable formula for the show horses.
Okay.
So there's now a calming formula, because a lot of the calming herbs are on the list for not being allowed to be used in competition.
Right.
So they have gone to the trouble and the expense of figuring out exactly which herbs and exactly which quantities, and each batch is certified to be safe for drug testing
Okay.
purposes.
Okay.
So that's something that's useful to know about if people are competing, because if you are competing under international rules or even USEF rules, in most of the sports, there are significant restrictions, and they are really being tough on people that violate that.
Right. Sure.
Homeopathics never will test. They're very dilute.
Ah, because of the dilution. Okay.
Yeah.
Okay.
Yeah.
Interesting. Wow.
Essential oils, on the other hand, because they can be absorbed by the skin, you have to be a little more careful because they're super concentrated.
Oh.
And some of those can test positive.
Very interesting. Okay. Very interesting. So going down my list then, I have a couple other things on here. The myofascial release. So the fascia system is something that is really intriguing me as of late, because I've heard and I've seen video clips of new documentaries that are being made about the fascia system in humans, in horses, in dogs, in all sorts of things. And that's really interesting stuff. So what can we say about the fascia system and the myofascial release? How does that work?
Well, the fascia is actually the ultimate soft tissue that holds everything together.
Okay.
So when you eat a chicken leg and that thin membrane appears.
Yeah, okay.
That is your fascia. And
it's kind of gross when you think of it that way.
Yeah. You have that from the tip of your head to the tip of your toes. It is covering and blending and just it's sort of painted on everywhere.
Okay.
And the more they're learning about fascia these days, the more fascinating that it gets.
Yes.
And there's actually the feeling now that fascia is the structure, and the bones are being held in place by the fascia.
Really?
So that's some of the sort of cutting edge thinking about fascia, and that's why
that kind of turns things down, doesn't it?
It does. It's kind of hard to wrap your brain around that, actually. But because we think of the bone as solid, and we see that little thin membrane, and we kind of go, yeah, how does that work?
Yeah, right.
And that's why the myofascial release, using that exact terminology, it's actually still a group of techniques that are designed to be, instead of aiming to release the muscle, they're aiming to release the tension in the fascia. In many ways, you can't really separate them because the fascia wraps around all the muscles. So you're releasing muscles. The fascia, have we all along thinking we're massaging muscles? Are we really massaging fascia? Probably so.
Okay.
And so that goes back to this, we're all doing the same thing, but using a lot of different terminology.
Okay.
And we are releasing the tension. The fascia doesn't have a blood supply as such, but it wraps around all the blood supply. So it influences the blood supply. And in many cases, it's the fascia that become tight as much as the muscle or tendon or scar tissue. The fascia gets all wrapped up in scar tissue. So you break apart scar tissue and you're releasing fascia. And there are many different myofascial release techniques, from
Mhm.
some that are very, very gentle and light to some where it feels like they're driving their elbow through your rib cage.
Oh.
And to a certain degree, it's personal preference, though I think, as is true with chiropractic and osteopathy, gentle is better for the body. The body's more willing to honor it. But sometimes you
Okay.
need to dig in a little deeper to get to something, to loosen it up. But it's all, the fascia may be the most important thing that we've just ignored for years.
Gotcha. Now, I've heard reference within some osteopathic circles that the fascia is now being referred to kind of as an organ of its own because of the way it communicates with the brain separately from the muscles and things like that. So what's that mean? What are we talking about
Well, what
there?
they're actually discovering is that even the gut is probably more important than our brain as an organ. And the fascia, they're able to study now this communication, and we actually have 2 new organs that have been properly discovered and named. One of them is a lymphatic vessel system that goes from the brain to the gut, or the gut to the brain.
Okay.
So there's now a direct connection between the gut and the brain. But there was also some research. The gut is often called the second brain, and the fascia is probably going to be called the third brain. And the heart, they also feel, has its own brain. So but some study they did, and I don't remember how they did it, or if I did, I couldn't understand it. But basically, the gut can operate without the brain, but the brain can't operate without the gut, which puts the gut over the brain as far as control of the body or some of the parts.
Wow.
And the fascia they're finding the same sort of thing. There is so much more cellular, intercellular, and inside the cell communication that goes on, and we are now just scratching the surface. Like thinking about the fascia as the structure.
Right.
And you can get into the whole microbiome aspect, which is all the good bacteria, is another area of research that even every cell that we have in our body is full of bacteria that are doing a lot of the work of the cell, that are doing the communication between the cells, that are doing the metabolic functions of the cell. So we're made of all kinds of things we didn't think we were made of.
That's super interesting.
Yeah, the whole microbiome research is just as mind-blowing as the fascial research.
That actually makes me think about a podcast that I listened to recently about trees and a forest. And I don't know how many of our listeners are big podcast listeners, but if they're listening to this one, I'm going to assume they're listening to at least 1 or 2 others. But they were talking about this fungus that lives within the forest, and it lives with the root system. And then it was talking about, it was super fascinating to listen to. I'll have to find the podcast again and share it in the comments section in the notes here. It was so super interesting. It was basically talking about the forest having a brain, and how when a tree knew that it was diseased, it would actually give all of its energy to this fungus that would pass it on to the other trees that needed it the most, and things like that. And there was this forest that they studied, I believe it was somewhere in like central Canada, and it talked about how this fungus would grow out from the root system of the trees, and it would grow to different nutritional sources. And this particular forest, the cellular nutrition, maybe, I don't know, maybe you've probably got better words for it than I do, but the nutrition of the trees was salmon from Alaska.
Yeah.
And this was central Canada. I mean, it was so fascinating this podcast about that. And so that kind of is sounding like what we're learning now about the body as being very different, and there's way more to it than we ever thought there was.
Yeah. And the whole, I mean, the mycelium part of the fungus is a mushroom. We see the mushroom as, the mushroom is a fruit. It's like an apple on a tree.
Okay.
The mycelium, that fungus that goes around the forest, is, if you dig down in the dirt and you see that kind of white,
yes,
slightly moldy looking stuff.
Yes.
That's the mycelium.
Yes.
That's the tree of the fungus, if you will.
Yes.
Of the mushroom.
And there's, what is there, miles of it within a handful?
Oh yes, it's incredible.
Yeah.
And it links everything together. And these things, some of these are huge. There's one that they figure been around, I've forgotten how many centuries, like million years or something like that. But that is the link for everything. And in reality, when you look at the microbiome of the horse, which they are studying, the human microbiome research is probably a little more advanced, but they are studying the microbiome of the horse. The microbiome of the horse and the microbiome of the people in the gut are mostly soil types of bacteria. The probiotics that we feed commonly are not what lives there. It's what helps make the environment good for what lives there. So what lives there is dirt bacteria. So my theory for the best probiotic we can give the horses is to make a little plot of organic garden soil, grow things in it that the horses like, and give them 10 minutes a day of eating those plants and pulling up the roots and eating the soil. Probably better than any probiotic we can buy.
That's very interesting.
And we should go out and pick those plants and lick our fingers and don't wash your vegetables that you grew in that good organic soil.
Right.
And that will give you microbiome that is more realistic.
Oh, that's super interesting.
What in the information, the bacteria all talk to each other. The fungi talk to each other. It's incredible.
So for our listeners that maybe are going to get a little confused over the word microbiome, can you give me a definition for that?
Yes. And the microbiome is the term for the DNA of all of our good bacteria. So the words that are more commonly known is probiotics.
Mm-hmm.
And we think of probiotics as being good bacteria that we can eat. So yogurt has probiotics in it.
Yes.
And so right now you go to the grocery store and they're putting probiotics in their sodas practically. They're starting to put probiotics in everything.
Right. Now that's the what is that? The Lactobacillus acidophilus stuff.
Yeah, lactobacillus is the most common.
Lactobacillus. Okay.
And that also is the least, it's not the least common in our gut, but it's not the most common. It is a form of bacteria that's in our gut, but it's easy to cultivate. It's easy to make products out of. We have not yet learned how to make the products that we need, and I would say we're anywhere from 1 to 3 or 4 or 5 years away from having a lot of really good products that truly change your microbiome for the better.
Mm.
But the microbiome is just a fancy term for probiotics.
Okay.
But it means though all those species that live in your gut. Actually, it's not just in your gut. We have bugs that live in our eyes. We have them in our ears. We have them on our skin.
Right.
And eventually, we will probably have skin creams with skin microbiome bacteria.
Of course.
we'll have eye drops, we'll have ear drops, we'll
Right.
have nose drops, you name it.
We're going to have product to feed all of the bugs.
Yes.
Oh my goodness. Wow. Well, but yeah, it makes sense.
But that's
So,
really where health is headed,
yeah,
is restoring the microbiome, because the bugs have become resistant to most of our antibiotics,
sure.
and so we have not managed to come up with more and more potent antibiotics.
Right. Yeah, we can't kill all the bugs, so we need to make them happy.
Yeah, we need to make them happy and stronger. And in fact, that is what happens with many of our treatments. And they have actually, the research is very solid on, there's a infection that kills an awful lot of people that is, it's a Clostridial bacteria. And the best treatment for it is what's called a fecal transplant. And
really,
it sounds gross, but
I've heard of this. Yes.
And it's been done in the cow world forever. The cow gets really sick, you just take some rumen fluid from the stomach fluid from another cow and you feed it to that cow.
Yes.
It has been done in the horse world for 30 or 40 years, but not very commonly when you have a really sick horse and with a gut problem. And they take some manure and then stomach tube it down. But now there's a lot of research on that. It is actually, most places won't do it, but, and you need to, if you're going to put feces into a fecal transplant into another being, you obviously want a healthy one, a healthy
Sure.
source.
Right.
And that's hard to find sometimes because we have so many animals that have had lots of antibiotics.
Okay.
The antibiotics kill off the good bugs.
Right.
That's why we commonly now will feed some probiotics when you give antibiotics. And we feed those probiotics because we know we're killing off all of the bugs.
Gotcha.
So we put a few probiotics down, which are the good bugs, trying to restore it, but in fact, it's very hard to restore it without things like transplant.
That's really interesting. So the fecal transplant, has that got any kind of similarity to what we see in foals as the coprophagy, where they'll eat the mare's feces?
Totally. They ain't dumb.
So they're doing what they know needs to happen, and we're just late to the party.
Yeah, exactly.
Interesting.
And that's exactly how they're populating their gut.
Sure, of course, and we've known that in foals for so long. Very interesting. Wow. My goodness. Well, Dr. Harman, we have overreached our 3-hour mark now on our conversation. And we haven't even gotten to half of my questions. So I think that you and I need to schedule a second issue of this second episode of this. That would be amazing. That'd be fantastic.
Anybody actually listens to all of this?
There are so many people listening to this. So just to give you an idea, I have lost the questions that have come in. We've had that many who have come in on our live feed here. We've had 111 comments right now, and I don't know why, but recently Facebook for some reason has changed how I can read these, and I cannot read them all. So the questions that came in at the beginning are now gone. So I feel really bad for anyone about that, but I'm going to go through after this is done, and I'm going to write down all the questions that we've missed. Because I feel like we could have probably, from the ones that I've seen, we could probably have a whole episode just on the questions that have come in.
Right.
A comment that just right now came in was, please tell Dr. Harman that this was fantastic. And absolutely this was. This is fascinating for me. I've got so many pages of notes here just from what we've talked about. and other questions that have come up. I wanted to chat just a little bit. I promised everyone that we would chat about saddle fit a little bit in this episode. And I think maybe the only thing I'm going to go with saddle fit is I've heard a story from a mutual friend of ours about saddle fit and about this electronic saddle pad that you may have been involved in this story about saddle fit for an elephant.
Yes, I had my computer underneath a elephant saddle, but you know how those technical problems happen. I don't have a great scan from it.
Yes, I heard that was quite a problematic trip.
Yeah.
So that friend, for everybody listening, that mutual friend of ours was Wendy Murdoch. And so you were in Africa with Wendy.
Yeah, and elephants are transport animals. I mean, they are ridden. It's a slightly different style of riding because the elephant is truly in charge. And you just pretend you think you're telling them where to go. But they were interested in the way that the saddle device framework that we were sitting on was affecting.
And it's very much a framework. It's I know I've done some training of camels and had been connected with elephant trainers and things like that throughout the years. The Hootie saddle is very much just a framework that kind of straps around. Yeah.
And it's interesting. I did some saddle fitting stuff with some llamas because llamas are used as pack animals.
Oh, yeah.
And they have sort of a framework that you would then put the pack on. And the same sort of thing can happen there with saddle fit, is that an improperly fitted pack saddle affects the gait because it affects the movement of the back.
Sure.
So anything that you put that's rigid onto a spine, no matter what the species is going to have an effect on the motion. So you want to have the least amount of effect and support the two structures, the human and the horse, or the human and the camel, or the human and some of the camel saddles that I have ridden in are soft, so you have less of an issue.
Right.
Than you do when you have the rigid tree. But in the horse world, sometimes when we have those soft, like treeless saddles, we introduce other issues. So just because something's soft or doesn't have a tree doesn't mean that there aren't issues.
Well, now there's going to be a whole podcast in itself right there.
Yep.
I can't wait for that one. Yes. Yeah, that's super interesting. And, I think all the time it goes back to, we've known about this for people for years. How long have we designed backpacks? Right? For proper shoulder support and proper back mobility and things like that. And we've added extra straps to them, lower straps, so that they hug closer to the back without bouncing and things like that. And we are. I mean, there's so much of this that we're kind of behind the science when it comes to horses. But I guess a lot of it, when we think about it, is because the horses can't talk to us in our language to tell us about it. Where a person can tell you, hey, this backpack doesn't fit because right here it pinches.
Right. And so there's the communication thing. And yet, once we start listening and looking, the horses are telling us that things hurt.
Absolutely.
And there's also the logistics of making a saddle that can withstand the pressures of 100,000 steps that horse takes, or 100 million steps. Every stride that horse takes there's a stress point where the stirrups are, where the girth attaches, that the saddle has to stay on and be safe and not break. And so it's easy enough. We can sit in the basement and design a saddle pad and sew it on a sewing machine and send it out into the world and put some different kind of foam in it and market it, and we're done. But to design a saddle that's actually going to be safe, that holds a person, and the gravity that's involved, you know, you're landing off a 5-foot fence. That saddle has to stay together. And it has to be symmetrical, and it has to be durable, and it makes innovation hard because you can't just do it in your basement. And if you're going to come up with a tree, let's say you're going to come up with a plastic tree, just to make a mold of a plastic, now we can do a 3D plastic thing, and that's just been in the last few years. So you can make a prototype. But in the past, you could make an injection mold. It cost you $30,000, $50,000, $40,000 just to make one mold.
Yes.
And you decide it's wrong.
Right.
And so that's $30,000 down the tubes.
Right.
Redesign it.
Right.
Make
Exactly.
another one.
Exactly.
So some of the sheer logistics of making saddles, I think, have stifled some of the innovation. It's very complicated, and it's easier now to do things with some of the treeless saddles and Velcro, sticking things together with Velcro, and you can actually have things that that are safe and are durable. But it's a tough thing to do, and the horses don't, you know. If a saddle doesn't fit, or, I mean, I've sent saddles back I know are crooked, and I know that the company just sends them out the next day to somebody else who doesn't know.
Yeah, absolutely.
A lot of misinformation, or just a lot of lack of information.
Well, you know, that's a very interesting point that I've not thought of with the horses, with our pads, with our saddles. You know, when we're talking about mobility. Again, I'm going to go back to the studies that we know about people, right? Because people are really good at saying, hey, this hurts, right? At exactly the moment that it starts to hurt. And we know with running shoes that after 300 to 500 miles, our running shoes are worn out. And yet we rarely, I won't say never, but we rarely think about that with our saddles and with our saddle pads, that there is actually a lifespan, right? So that's super interesting. So the idea of the 100 million steps.
Yeah, and I don't know how many steps a horse would take, but you know, you pay $5,000 for a saddle.
Yeah.
I don't want to have to replace it in 2 years.
Yeah, absolutely. Ride him less.
Yeah. So it's, and you think about the forces of, you know, galloping up a hill.
Right.
Just the forces on that saddle that have to keep you intact, have to keep the girth. The most important thing is to keep the girth and keep the whole thing on the horse.
Right.
Having had a girth break in the middle of that same African trip.
Oh, no kidding. Oh, geez. Oh, my gosh.
In the middle of a water pond, while my horse was bucking.
Oh, no.
And my camera was around my neck.
Of course. I mean, yeah. Right? What else can we add to that story?
There wasn't a lot else.
Was there a beautiful sunset, at least, in that moment, or something?
No, I didn't get a sunset picture as I was falling.
Oh, goodness. Wow. Wow. Yeah, there's so much to it that we don't think about. And your comment about the 100 million steps there, that's the first that I've thought about, the idea that the saddle can potentially wear out also. Just like our shoes. I mean, and we know about saddles wearing out because of things like the leather has a lifespan, and we can take care of it, and we can promote it and things like that. And if we have a Western saddle, we can have it, you know, refleeced, and our English saddles we can have reflocked. but the structure itself, just like our running shoes. Yeah.
The ones that are made with foams have a lifespan, and the flocking has a lifespan that, I mean, when I first learned about that, my saddle hadn't been reflocked in 15 years.
Sure, right, exactly.
I dare say we see a ton of saddles that could be reflocked, but just haven't been.
Yes, and there's so many conditions that are part of that. Like I'm gonna call myself out for it. My dressage saddle sits in the back of my car in 100-degree weather, the same as it sits there in -20-degree weather, and I know the flocking has just died, right? And I've only had it for about 1.5 years, but it's dead. You know, the flocking in it is completely dead, and it needs redone.
And flocking, even the best of flocking in the best of conditions, probably is only good for 1 year or so. And it may not need to be completely taken out and removed, but it needs to be refreshed and some more added, or the clumped up stuff taken out.
Yes.
And that's something that you then need somebody who's skilled to do that, because you can destroy a saddle by flocking it incorrectly. Either flocking it unevenly and stretching your leather out unevenly, or overflocking it and getting your leather so stretched out that you can't come along and really fix it well.
Right, right. And I would imagine, you know, flocking and having dead flocking still in there, right? Like we talk about flocking, putting that in there, but there's some stuff that's in there that's been in there for so long that it's dead. There's no use to it anymore.
Needs to come out.
Right, it needs to come out. And so if it doesn't come out, then you're just adding to dead stuff, you know?
Yeah. And the resiliency and the spring and the interface changes from something that has spring and has a kindness to it to something that's lumpy.
Yes, right, right. That's a great way of saying it. The interface has changed, because that's exactly what it would be, right? You'd have part of the saddle, the new flocking, that would respond the way we would want it to respond to the movement of the horse. And then that dead flocking would have no response whatsoever. Yeah. Interesting. Very interesting. So there's so many questions that I still have, so many things so many pages of notes that we could go on with from this. I did promise someone, and I promise after this question, we're going to get to our wrap-up questions. I did promise someone that I would ask you about the PEMF therapy. That's what is that? Pulsing?
Pulse electromagnetic field therapy.
Yeah, that.
And that the basic PEMF has been around, I think, since the 40s. And it's the exact science behind it, I don't totally understand, but it's basically an electromagnetic field, and we are magnetic beings. Our bodies respond to magnetic north. We are electrical beings. That is our nervous system is electrical. And so the PEMF therapies interact with our body and with our electrical system and with our magnetic system. And not that we have a magnetic system, but our ability to respond to magnets. So there are a gazillion pulse electromagnetic therapies out in the world.
Okay.
And the original research here back in the 40s was on non-healing bones, non-union fractures, and it definitely stimulates healing, and it stimulates healing in many, many parts of our body. What has happened is that we now have devices in every price range from $25 to $15,000-$20,000, and lots of people trying to sell them. And they are They are a useful therapy. They have a place. They aren't a cure-all for everything, which some people feel they are.
Sure.
They can be used both localized. I use a fair number of them for local treatments. You have a tendon injury or a ligament injury or a wound or something like that. And there are much larger machines that you can put on the whole back of the horse. And the quality of the equipment varies a lot. There is some, when you really read about it, there are differences in power, there are differences in wave form, and those have different effects on the body. And I'm not super up on the exact science of what's the best, but the real conclusion is that there isn't necessarily one that's the best. There is what is your goal for the treatment.
Okay.
So sometimes you want fast results, you need a little higher power. Sometimes you can have slower results over a longer period of time. More chronic conditions, you can get away with a lower power machine. I think they are a useful adjunct and they are safe for people to use. Most of them. There are a couple of machines that are really kind of, I see them misused more than I see them used correctly.
Oh.
But I think it has a good place in our integrative treatment field.
Okay.
But
You
I think
mentioned.
you need to do a lot of learning and a lot of figuring out how much you actually want to invest in it.
Sure. So you mentioned that some of them you see misused more than used appropriately. Let's touch on that real quick because I feel like that's something that could be important for our listeners.
There's one machine I have to think of. I'm not sure I can think of the name of it right now.
Okay.
I'm not very good with all these 5 million different machine names. But,
you mean you don't have them all right here on the tip of your tongue? I mean, it's almost every day that there's 20 new ones coming out.
I know.
for everything, right?
All kinds of stuff. But it's a machine that has it's a fairly powerful one, and the horses where I have seen it used where the horses are comfortable, and I've seen it used where the horses are basically put into almost a spasm, and it can be quite painful. Okay. And I can't look at those horses and say I think that they're getting a useful treatment because the horse is so stressed out from the way the machine's being used. Okay. So with any machine, I think the important thing to take away is not a brand name of this is good or this is bad, because there's more out there than any of us can really evaluate, is to learn as much as you can about the technology that you're signing up for. There's the PEMF machines, there's the red light machines, there's the God knows what, bioforce machines. I mean, you name it, there's all kinds of machines out there. Right. And I'm not really a machine person, but I do think that the machines in the right hands, used well, can be a perfectly good tool. Mm-hmm. So you want to learn as much as you can about it, and then learn about the different types of machines in that are comparable. And it's easy enough with the internet these days to look up reviews and look up issues and really study it and make a purchase that makes sense for you financially. And realistically, these machines all take time to use. And to spend $2,000 or $3,000 or $4,000 or $5,000 on a machine that you're going to use for 3 months and get bored with is right. When you're done with it, send it to me, okay?
Right. That's kind of like running shoes, right? I've seen people that'll go out and spend a boatload of money on running shoes and run 3 times.
Yeah. And there's a whole lot of lasers sitting around in barns.
Yeah, right? Exactly.
Because they're great, and a laser is one of the safest, really useful tools in a barn, but it takes time.
It takes time, sure.
And so if you have 10 horses in a barn, that's great, and you have a staff person that's really happy to do.
Right, somebody dedicated to it, sure.
And then they quit, and the next thing you know, even if they're around for 2 or 3 years, then they move on and do something else.
Yep.
And suddenly it's sitting there.
It's collecting dust.
Learn how to use it.
Yeah, yeah.
So take all those things into consideration, and sometimes you can accomplish something with a simple little machine, or just even a disposable. Some of the PEMF things that I use are disposable, and they last 3 or 4 months, and they're done. So use it to heal up an injury or a problem, and then not have to worry about having a $5,000 machine sitting around.
Gotcha. Perfect. So
that's true for all of those machines.
Yeah, and it sounds that way. It sounds like that would make sense with all of the modalities that we're talking about, really.
Yeah.
Whether it's, the normal medicine, conventional medicine, or the holistic medicine, the integrative medicine. It's about what you're actually going to use, what you're going to invest in, what you're going to focus on. So that's going to lead me to a question here before we get to our wrap-up questions. The team, right? I feel like owning a horse, keeping a horse as an athlete or not, at their fittest, at their best, that's going to take a team. Who would we have on our team? Let's say you and I decided to buy a horse, and it's a performance horse. I don't even care what kind of performance, but you and I are going to invest in a performance horse. Who are we going to have on our team?
So you want one of your key people is going to be your farrier.
Okay.
No foot, no horse.
Yep.
You're going to want, you're traditional, you'd need a veterinarian, and a practice that can be available for emergencies.
Mm-hmm.
And there are parts of the country where that can be tough.
Yes, absolutely.
And ideally, this team would all be willing to talk to each other.
Yes.
That would be a lovely.
An integrated team, yeah.
Yes, that doesn't feel like everyone's trying to undercut each other.
Right.
And then I would want somebody capable of doing chiropractic or osteopathy from a gentle approach, acupuncture, and a lot of times you will find a veterinarian that does both, and other times you don't.
Okay.
Some people need to have either, have 2 different people that fill those roles.
Okay.
And that's perfectly fine. I certainly want access to some massage or some kind of soft tissue work, or whether it was I would not say that it has to be a particular style of massage therapy, because there are many that are effective, like we've been talking about.
Okay.
You need your saddle fitter, and you obviously need people taking care of the horse.
Mm-hmm.
But you need your dentist.
Okay.
And that is a role that can be veterinary or non-veterinary. There are veterinarians who love to do teeth and who are great at it, and there's a lot of them that really are not.
Right, and that's a whole study in itself, really.
That's a whole different.
Yeah.
Dentist. And in some ways, that's probably the basic team. You may end up with referral practice kind of places for a piece of equipment that you need, like a fancy ultrasound or something like that. It's nice to have if your veterinarian doesn't have that, to have a backup second opinion type practice.
Perfect. And then I'm assuming we would also add to this the trainer or the rider of this horse.
Oh, details.
Yeah, details, right?
You actually want to ride this horse.
Right, yeah. Yeah, I mean, she's cute in the field and all, but, you know, we're going into this on partnership here, Doc, and I want to make sure that we got something good going on.
All right. So, yeah, then we need a trainer, then we need the rider, but then we need the acupuncturist for the rider.
Ah, so there's a whole new subset here.
Yeah.
I see.
Chiropractor and the physiotherapist, because we're going to land on the ground probably once or twice.
Because we're talking about a really good athletic horse here, right?
Yeah.
We're not just talking about some dink that if they buck as hard as they can't unseat us. They're going to launch us.
Yeah. Or step on our foot. Or,
Right.
Yeah.
Suddenly I'm thinking I don't want to buy a horse in partnership with you.
It's going to be a good horse.
Right? Oh, she's going to be amazing. Yeah.
Yeah. And then, you know, we need, what else for the human? We need a massage therapist for sure. Get him going.
Right. I'm going to think we need like a bootmaker or something, you know?
Yeah. Gotta have those shoes, you know?
Right.
You only get shoes once a year. The horse gets shoes every 4 weeks.
Right. So, and actually now looking at our list for the horse and now for the rider, our saddle fitter is certainly going to play a role in that as well.
Yes, the saddle fitter is going to be the go-between.
Yeah, exactly.
And really the saddle fitter, the trainer, are the two go-betweens.
So I'm also going to think, and correct me if I'm wrong, I'm going to think about the dentist too, because the dentist is going to be able to talk to us about bridle fit.
Yeah, or should be able to.
Right.
Yeah.
Which is going to have a lot to do with rein contact and, you know, and all those things.
Yeah, and the whole bidding thing, I mean, that's a whole nother webinar.
Right? I think you and I are going to be talking quite a bit in the future. This is great. This is great. Well, we have several folks who have been commenting, please come back. And yes, we need more podcasts. We need more discussions. This is great. I've got a whole list of people that you and I need on our team to go buy a horse. So we're going to have to work on that.
Very expensive horse.
Right? Exactly. Exactly. Oh, geez. And then there's the nutritionist, because we've got to feed the horse. And the nutritionist for the rider. Right? No, that's one I'm super interested in chatting about with you as well, is nutrition. And we are at over 3.5 hours now on our chat. So I'm pretty sure that this marks the longest podcast that I've done. And I'm loving it. You've been so much fun to play along on this journey. Thank you so much for your time with us. This is great.
Yeah, it's been fun. We've covered a lot of ground and touched on a lot of things, and got a long ways to go.
Well, we do. My goodness. I'm pretty sure I've got at least 10 or 15 pages here of notes, of, you know, notes that we've had, points that we've touched on, and questions that have come up along the way. So I'm sure hoping I can twist your arm and snag you into at least one more conversation here, because I think it's going to be great.
Oh yeah, we can do that. This is
awesome.
This is pretty painless because I can walk around, stretch my legs,
right?
Talking, and
perfect. See, I'm a little bit jealous because I have a camera on me the whole time.
Yeah, you're probably getting a little stiff.
Right, I can't wait to get up and move after this. Our viewers are going to start watching me do a little bit of cardio while I'm chatting here as we do this. Yeah. But no, this was so great. So let's see. So I have some wrap-up questions, and these are kind of just some rapid-fire questions that I ask everybody at the end of these podcasts. So if there was one specific thing that you would recommend for riders and owners to focus on as a primary means of improving, I usually say their horsemanship, but we can say the horsemanship or the health of their horse, what would that be?
Soft tissue.
Oh yeah, I kind of had a feeling that's exactly where that was going to go.
Yep.
Soft tissue.
So,
Perfect.
soft tissue. So, and you can do it yourself with stretching, or you can, hire the practitioners in. But if
Yes.
you just do that,
That's
you
awesome.
will do a lot.
That's awesome. Perfect. Okay, let's see. If you could ride with anyone, past or present, who would that be and why?
I would pick Wendy Murdoch.
Ah,
An amazing eye.
yes. Yes, she does. Absolutely.
And I had not myself trained with tons of different people, so that would color my. I didn't get out and compete tons. I just rode lots.
Yeah, yeah. Wendy does have a fantastic eye. I share stories about my time with Wendy all the time because of how good her eye is on picking up some of the most subtle things in the rider. I had her last year, actually a couple times on my podcast, and I shared with her a story that she had even forgotten of a clinic that I hosted for her. And she starts most of her clinics, or the ones that I've seen anyway, maybe it's not most of them, but it's most of the ones that I've seen, she starts them with, okay, so tell me all the injuries you've ever had. And
Yeah.
she writes them all down, right? And in this particular clinic, a friend of mine was riding, and she gave her probably 486 different injuries she's had through her life. And she got on her horse, and she didn't get more than a 20-meter circle in. And Wendy went back and was leafing through her notes. And she looked back up and she said, why didn't you ever tell me about your shoulder injury? Your right shoulder. She was specific. I remember this. She said, your right shoulder injury. And I thought, wow, how did she know that? Yeah, Wendy's fantastic at picking those things up. So that's awesome.
And you can't really cheat with your body.
No.
You can see it.
Well, that's exactly it. And it's interesting because that's kind of the answer. I asked Wendy the question. I said, how did you know? Right? Like, how could you call it out? She didn't say, have you ever had a right shoulder injury? She said, why didn't you tell me about your right shoulder injury? And it was an injury that had happened several years prior. And her answer was really interesting to me. She said, when you learn to recognize where movement should be, you can see when it's not there.
Yeah.
And that was fascinating to me.
Yeah.
And it's that same way with the horses, right?
Yep. Absolutely.
Yeah. Yeah.
That's a really, and she's so good at summing things up like that.
Right.
The way you go, oh, yeah.
Duh, right?
Why didn't I think of that?
Right? She's so good at that. She's so good at that. That's awesome. Okay, so since this is a horses and horsemanship podcast, what's your present personal definition of horsemanship?
I would say that it is being able to know and understand your horse, listen to your horse, and acquire the skills to move that horse or whatever horse you have forward in your progression of what you're attempting to come out.
Awesome. Awesome. Fantastic. What book are you currently reading, or what was the last book you read? So this doesn't even have to have anything to do with horses.
What I'm actually reading, probably the book that I have read the most of recently, I've been reading an astronomy book. I can't even remember the name of it. Because I go out and take pictures of the night sky.
Ah, okay. You're a nature photographer as well, right? On top of everything else.
Yeah.
Yeah. Interesting.
So that's what I have been kind of studying.
That's
on
awesome.
My outside.
That's awesome. I love that. I love that. Okay, so I'm going to steal a question from another podcaster, Tim Ferriss, that I listen to frequently. I love this question that he has. If you had a giant billboard to print any message you wanted on it for the whole world to see, what would that message be?
I could think of quite a few things, but
Well, we could go with a couple if you need.
yeah, I think it would be to be kind and be understanding, particularly of the animals,
Mm.
because they have a lot to teach us, and we don't listen.
Isn't that the truth? That's awesome. I love that. I love that.
And we need to be kind to fellow humans too.
We do.
But
Animals of all species, right?
of all species, yeah,
Yes. Yes.
including the spider that moved her egg case before I could move it. We talk about, things not being intelligent all the time. People are, oh, it's just a dumb animal. Well, I had a little conversation with this big, huge wolf spider who had a big egg case, and I'm like, tomorrow morning I'm going to move you outside to the woods where, you belong.
Where you belong.
So, well, she's in the house all the time, and I always put her out. But I didn't particularly want her egg case and her in the house. So the next morning I go and look as soon as I get up. Do you think there was a spider there?
Nope.
Nope. She took her egg case and moved.
That's awesome.
So
Good
you
girl.
tell me these things, everything's got some intelligence. It's got something to teach us.
Yeah.
So.
Yeah, absolutely. That's awesome. That's awesome. All right, Dr. Joyce Harman, how can folks find you?
Type my name in the computer.
Yeah, that's how I found you.
Yeah. HarmonyEquine.com, spelled with an A, but actually type in Harmony with an O. It'll get you there too. And I've got there's a YouTube channel that I've got some stuff on. I've got a newsletter you can sign up for on the front page of the website. There's a Facebook page. There is, I guess those are the main things.
Okay. Awesome.
And there's a fair bit of educational stuff on the website. And the newsletter I tend to put out, I try to put educational stuff in there. So.
Perfect. Perfect. Good.
Stop on by.
Stop on by. Absolutely. Yeah. With a quick Google search, there's a lot to find about you. You're very well written. You've published quite a few articles. There's a lot to read from you out there in book form, in article form, and like you said, in Facebook form as well. So that's perfect.
Yeah.
Awesome.
Yeah, and I've got a number of articles coming up in places like The Holistic Horse, Natural Horse, and Equine Wellness. All of those have had articles or will soon.
Awesome. Good. Okay. So when I do all of my, or most of my video broadcasts, I have a question of the day. That's where I ask folks a question, and our listeners get to answer. So when I have a guest on, the guest gets to ask the question of the day. So the question of the day today is going to be turned over to you. So what question do you have for our listeners for today?
good one, I think. So, have you ever gotten a clear message from your horse? And that can be verbal, it can be physical. I mean, being dumped on the ground can be a clear message.
Could be, certainly.
If you understood where it came from.
Right.
It could be telepathic, communication-wise, but have you ever gotten a clear message that you understood came from your horse?
That's an awesome, awesome question. I love that. All right, gang, you've heard the question. Dr. Joyce Harman, thank you so much. This has been so much fun. We are at about 3 hours and 45 minutes now for this podcast. That's definitely, I'm pretty sure that's a new record for me. That's awesome. Thank you so much for joining me for this.
You are welcome.
Thank you.
I look forward to it again.
Yeah, well, good. I'm so glad to hear you say that first, because I'm going to totally nail you down for another one of these. And after hearing that we are so close together in Virginia, you being in Flint Hills and me being in the Stanton area, right? I am looking forward to many future communications in person, over the phone, and through this whole Facebook stuff. So,
yeah.
Awesome.
Give me a buzz. Stop by.
Awesome. Awesome. Perfect. Hang on just one moment for me here. And gang, I want to thank you so much for tuning in for episode number 32 of Talking About Horses. And I never thought when I started this whole Talking About Horses idea that we'd even make it to number 32. So the fact that you guys are here with me is amazing. Thank you for being here for episode number 32 of Talking About Horses. I really appreciate you giving Dr. Harman and I your ear. Please remember that if you've missed any of it, you can access the full broadcast through Facebook, YouTube, from iTunes, or by streaming directly from my website by accessing the Talking About Horses page from the Education drop-down menu. Through whatever platform you're listening, please be sure to give us a rating, comment, a review, and a share with your friends. Your word of mouth and support is absolutely the fuel for this fire. Thank you so much, gang. I hope you'll tune in next time.
Hey there, gang. Patrick King here. Every other week, I send out an exclusive email newsletter to help riders reach their goals with their horses. These 5-Bit Friday emails include evaluations of exercises and movements for your horse, rider psychology tips, my personal reviews of books or videos, important thoughts on equitation, anatomy insights, quotes to ponder, lots more. 5-Bit Friday is only available if you subscribe to our email list. If you're interested in receiving these exclusive emails, register today by visiting my website at pkhorsemanship.com/newsletter. Thank you in advance for signing up, and I hope you enjoy and gain lots of value from 5-Bit Friday.
Thank you so much for listening to this episode of Talking About Horses with Patrick King. If you enjoyed today's show, please leave a review and subscribe. For more great content and to stay up to date, visit pkhorsemanship.com. We'll catch you next time.